changes in the committee amendments.
Mr. Chairman.
Ranking Member Boss.
Mr. Chairman, pursuant to Rule 11, Clause 2, I give notice to intent of filing minority and supplemental, additional, and/or dissenting views on H.R. 8260.
Without objection, so ordered. The committee will now proceed to the consideration of H.R. 7846. The clerk will please designate the bill.
H.R. 7846, to increase...
The text is circulated in advance pursuant to committee rules. Without objection, the first reading is dispensed with. I will now recognize Ms. Luria for 5 minutes to discuss her bill.
Well, thank you, Mr. Chairman. As the chair of the Disability Assistance and Memorial Affairs Subcommittee, which has original jurisdiction over this issue, I'm honored to present this year's cost of living adjustment legislation for HVAC consideration. Actually, I'm pleased to say this is the fourth year in a row that I've had the opportunity to bring this forward. And for the previous 3 years, we have a great track record of taking care of our veterans and having that signed into law. So I anticipate we'll continue to receive that broad bipartisan support in both the House and the Senate. This year's COLA would once again recognize that VA-related compensation requires adjustment in the same way that Social Security benefits are updated to meet the cost of living realities presented by the current state of our economy. This includes all disability compensation, clothing allowances, and the dependency and indemnity compensation payments. One of our veteran service organizations, the VFW, for example, said that this would provide a guarantee to veterans and survivors that their payments will always be aligned to counteract inflation. Also, a quote from another veteran said that it's a huge blessing to get this because now my family can just stabilize. So veterans definitely count on this additional assistance each year, and especially as disability care, clothing, and childcare costs are all on the rise, it's vital that we continue to provide benefits that accurately meet the financial demands faced by veterans and their families on a day-to-day basis. This cost of living increase would bolster beneficiaries against today's inflation, and without consistent increases such as this, which we've done year over year, our recipients would face reduced purchasing power, and it would just be harder for those veterans who served our country to get by. This cost of living adjustment recognizes the need to ensure that those receiving VA compensation are able to break even and have that economic stability in these difficult financial times, and our veterans and their families deserve no less. So I would like to thank Ranking Member Nels for being a co-sponsor of this legislation, and I welcome full committee support for H.R. 7846 so that we can reliably continue to assist our nation's veterans. And I yield back.
Well, thank you, Representative Luria. This bill requires the Department of Veterans Affairs to increase the amounts payable for wartime disability compensation, additional compensation for dependents, clothing allowance for certain disabled veterans, and dependency and indemnity compensation for surviving spouses and children. Specifically, VA must increase the amounts by the same percentage as the cost of living increase in benefits for Social Security recipients. And to me, the cost of living adjustment to veterans' compensation is more than just a rate adjustment tied to inflation. It's a quality of life guarantee for veterans and their families. This annual COLA is not only a source of personal comfort for former service members as they age, it assures their survivors will not see a decline in earned benefits if the economy may fluctuate and costs rise once their beloved veteran is no longer with us. I know this because veterans and their family members rely on this message. I know this because veterans and their family members relay this message to me from all over the country. The COLA is the recognition by a grateful nation of the service and sacrifice of those who have stepped up to serve. I'd like to recognize the Subcommittee on Disability and Disability Assistance and Memorial Affairs for once again presenting this legislation for our consideration, and I thank Chair Luria and Ranking Member Nels for their steadfast assistance to our vets. And I'm pleased we are moving this bill early to alleviate any doubt this adjustment will be in place come December. With so many still feeling the economic effects of the COVID-19 pandemic and our extended recovery, it's needed more than ever. This increase has been supported by Republican and Democratic presidents alike. It should not be hijacked as a means to discuss inflation caused by supply chain shortages, international conflict, and economic growth, but rather view it for what it is, a gesture of appreciation and one of the most rewarding responsibilities of the Committee on Veterans Affairs. I wholeheartedly support H.R. 7846 and urge all my colleagues to do the same. Is there further debate on H.R. 7846?
Chairman.
Bost.
Thank you, Mr. Chairman. I'd like to thank Congresswoman Luria and Congressman Nels for introducing H.R. 7846, the Veterans Compensation Cost of Living Adjustment Act of 2022. This bill would help ensure the values of veterans' benefits keep pace with the inflation by giving veterans a cost of living increase that matches the increase in Social Security recipients that the Social Security recipients get. Veterans and their families should not be worried about how they're going to pay their bills when prices go up, especially when they are facing historical rates of inflation today. According to the Bureau of Labor Statistics, as of June 2022, the Consumer Price Index rose 9.1% over the last year. This is the largest increase in decades. Inflation is a tax on every American. Every American is seeing the effects of these rising costs when they go to the grocery store and the gas pump. We must pass the COLA to ensure that veterans are able to put groceries on their table and gas in their cars. I fully support the bill, and with that, I yield back.
Thank you. Thank you, Ranking Member Bost. Is there further discussion on the bill? I see Ranking Member Nels would like to speak. You're recognized for 5 minutes.
Thank you, Chairman Takano. It is an honor to continue the bipartisan tradition of the DAMA Chair and Ranking Member co-leading the annual Veterans COLA. I fully support H.R. 7846, the Veterans Compensation Cost of Living Adjustment Act of 2022, and would like to thank Chair Luria for introducing it with me. This bill would ensure that the value of veterans' benefits is not eroded by inflation. This legislation is critical considering Americans are facing a 40-year high rate of inflation under the Biden administration. According to the Consumer Price Index, prices rose by 9.1% in June of 2022 compared to the prior year. Veterans and their families are seeing higher prices at the gas station, grocery store, and in the housing and rental markets. If the COLA is not enacted, inflation becomes a tax on every veteran's earned benefits, and that is unacceptable. This bill is necessary to ensure that veterans and their families can continue to pay their bills, and I urge all my colleagues to support it. With that, I yield back.
Thank you, Ranking Member Nels. Is there any further discussion on H.R. 7846? Hearing none, I recognize Ranking Member Bost for a motion.
Thank you, Mr. Chairman. I move the committee report H.R. 7846 favorably to the full House of Representatives.
All those in favor will say aye.
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 Opposed will say no. In the opinion of the chair, the ayes have it. The motion is agreed to. Without objection, the motion to reconsider is laid on the table. Without objection, the staff is authorized to make necessary technical and conforming changes in the committee amendments.
Mr. Chairman.
Ranking Member Bost.
Pursuant to House Rule 11, Clause 2, I give notice of intent to file minority or supplemental additional or dissenting views on H.R. 7846.
Without objection, so ordered. The committee will now proceed to consideration of H.R. 7299. The committee will please designate the clerk will please designate the bill.
H.R. 7299, to require the Secretary of Veterans Affairs to obtain an independent cybersecurity assessment of information systems of the Department of Veterans Affairs and for other purposes. Be enacted by the Senate.
Madam Clerk, I need to, the text was circulated in advance pursuant to committee rules. However, as per our rules, since Mr. Mervan is not here, we cannot consider this bill at this markup. At the moment. At the moment. At the moment. At the moment. We'll proceed to the next bill, and if Mr. Mervan gets back onto the, is able to join us, we will then look at
Mr. Chairman, I am here.
Are you here?
Yes.
Okay. All right. So we will go back in order. Where are we? Okay, so the clerk was the clerk, without objection, the first reading is dispensed with the first reading of 7299. Now recognize Mr. Mervan for 5 minutes to discuss his bill. Mr. Mervan.
Thank you, Chairman Takano. Thank you for including my bill, the Strengthening VA Cybersecurity Act, or the SVAC Act, in today's markup. Cyber attacks against the U.S. are increasing in scope and severity. Last year, a cybercrime group linked to Russia held the largest fuel pipeline in U.S. hostage. In 2019, the SolarWinds attack disrupted the networks of multiple government agencies and private companies. Many experts have called that the greatest act of cyber espionage in history. A few short weeks ago, the FBI announced that they prevented a cyber attack last summer aimed at disrupting the network of the Boston Children's Hospital, reportedly sponsored by an Iranian government. However, despite the growing threats, VA continues to make little progress in information security. For the last 3 years, and despite over $450 million in annual information security funding, VA continues to receive a rating of not effective in the annual Federal Information Security Management Act, Fisma Audit. According to the VA officials, in 2020, 46,000 veterans had their personal information compromised after hackers breached the VA computer system. The Department of Veteran Affairs is the largest integrated healthcare network in our country. It also has the second largest IT footprint in the federal government, behind only the Department of Defense. This is unacceptable, and the action must be taken to improve VA cybersecurity. Fortunately, this legislation will move us in the right direction and will give the VA the tools it needs to effectively protect against new and emerging cybersecurity threats and safeguard our veterans' personal information. The SFAC requires VA to obtain an independent cybersecurity assessment of its required VA to develop a timeline and budget to fix any weaknesses and deficiencies identified by the report. Finally, the bill requires the GAO to do a gut check and brief Congress, ensuring that the Secretary plan will actually address the deficiencies in the assessment. It will help protect against advanced cybersecurity threats, ransomware, denial of service attacks, insider threats, threats from foreign actors, phishing, credential theft, and other cybersecurity threats. The bill also ensures that the entire department's IT is covered, including on-premise, remote, cloud-based, and mobile information systems. I would like to thank Senator Jackie Rosen, and her staff for their work on this bill. I also appreciate the close working relationship with my colleagues, Nancy Mace, Rep. Susie Lee, and Rep. Andrew Garbiano, and look forward to continuing to collaborate with you to move this common sense and bipartisan legislation forward.
Well, thank you, Mr. Mervan. I recognize Ms. Representative Mace to offer an amendment.
Thank you, Mr. Chairman. I have an amendment in the nature of a substitute.
The clerk will designate the amendment in the nature of a substitute.
Amendment.
Thank you.
Amendment in the nature of a substitute to H.R. 7299.
Clerk, the text was circulated in advance pursuant to committee rules. Without objection, the reading of the amendment is dispensed with, and the substitute will be considered as original text for the purpose of amendment. Ms. Mace, you are recognized for 5 minutes in support of your amendment.
Thank you, Mr. Chairman. I'm the proud sponsor of H.R. 7299, the Strengthening VA Cybersecurity Act, with Chairman Mervan. The VA is the second largest federal agency. It handles the personal, health, and financial information of 9 million veterans, as well as their family members. Unfortunately, the VA is a big target for cyber criminals. Most of the cyber attacks we read about in the headlines impact the VA, and there are thousands of attempts every single day to breach VA networks that we just don't hear about in the news. This legislation fills in some of those gaps that exist with annual Federal Information Security Modernization Act audit. While the Fisma audit is largely a compliance exercise, our legislation requires a third-party audit of actual VA systems and real-world vulnerabilities. And just in 2020, we know that there were 11 federal agencies that were hacked of the federal government. And the amendment in the nature of a substitute would improve upon the original bill by focusing on 5 of those systems. It also requires the VA to submit a plan that clearly responds to whatever issues may be identified in that third-party audit. Cybersecurity is a major focus for the OIG, but it can be hard to assess how well the VA is truly performing and how successfully the money that is being invested translates it into better security for veterans' data. This legislation is a new idea to try to better answer that question. I appreciate the opportunity working on it with Chairman Mervan today. Thank you, Mr. Chairman, and I yield back.
Well, thank you, Representative Mace. This is a bipartisan and bicameral bill that seeks to have an independent assessment of VA cybersecurity readiness by a federally funded research and development center, the FFRDC. This bill is necessary because of the poor performance of VA in recent Federal Information Security Management Act, or Fisma, audits and independent audits from VA OIG on individual sites. This bill seeks to address the issue of shadow IT, which has been a priority of the committee this Congress. If VA does not know what is in their networks or on their networks and can't identify assets being utilized outside the Office of Information Technology, then they can't secure it. VA's repository of veterans' health information needs to be protected. We owe it to veterans to fix this problem now and continue to have veterans keep their faith in how VA secures their personal information. Is there further debate on the Mace Amendment?
Mr. Chairman.
Ranking Member Bost.
Mr. Chairman, thank you. I support Congresswoman Mace's amendment in the nature of a substitute. As the committee heard a few weeks ago, VA's cybersecurity has a number of concerning weaknesses that appear year after year in the Inspector General's audits. Congresswoman Mace's amendment in the nature of a substitute would make necessary changes that will improve the effectiveness of this bill, and I am glad to support it. And with that, I yield back.
Thank you, Ranking Member Bost. Any further discussion on this bill or on the Mace Amendment? If not, the question is on the Mace Amendment in the nature of a substitute. All those in favor will say aye.
Aye.
Any opposed will say no. In the opinion of the chair, the ayes have it, and the amendment is agreed to. Without objection, the motion to reconsider is laid on the table. Is there any further debate on H.R. 7299? Ranking Member Bost.
Mr. Chairman, I move the committee report H.R. 7299 as amended, favorable to the House floor of House of Representatives, full House of Representatives.
All those in favor will say aye.
Aye.
Aye. Any opposed say no. In the opinion of the chair, the ayes have it. The motion is agreed to. Without objection, the staff is authorized to make necessary technical and conforming changes in the committee amendments.
Mr. Chairman,
Ranking Member Bost.
pursuant to Rule 11, Clause 2, I'll give notice of intent to file minority and/or supplemental additional and/or dissenting views on H.R. 7299 as amended.
Without objection, so ordered. The committee will now proceed to the consideration of H.R. 8003. The clerk will now read, or will please designate the bill.
H.R.
Text is
8003.
circulated in advance pursuant to committee rules. Without objection, the first reading is dispensed with. I now recognize Representative Sherfullis McCormick for 5 minutes to discuss her bill. Representative McCormick, Sherfullis McCormick.
Good morning, and thank you so much, Mr. Chairman. I'm happy today to bring H.R. 8003, Restore Veterans Dignity Act of 2022, which would make permanent the flexibilities granted in Section 4201A of the Johnny Atkinson and David Rowe Veterans Healthcare Benefits Improvement Act of 2021. The bill is a critical step forward in expanding assistance to countless homeless veterans and simplifying the process of securing housing and the necessities veterans require to build a strong foundation which they can thrive off of. Veterans are brave and heroic. These soldiers put their lives on the lines to defend and protect our precious democracy. They protect the freedoms and uphold the principles and the laws that govern us and make our nation unique. Unfortunately, according to the United States Department of Housing and Urban Development point-in-time count conducted in 2020, there were around 37,000 veterans experiencing sheltered or unsheltered homelessness. Over the course of a year, approximately twice that many experience homelessness. Only 7% of the general population can claim veteran status, but nearly 13% of our veterans are homeless. In response to the COVID-19 pandemic, our colleagues passed the Johnny Atkinson and David Rowe Veterans Healthcare and Benefit Improvement Act of 2021, which included Section 4201A, that for the first time ever allowed the Department of Veteran Affairs to use funds to pay for basic needs of veterans experiencing homelessness. I am pleased that as of December of 2021, the VA has dispersed more than $20 million under this authority to meet the immediate needs of the veterans who lack the stable housing, transportation, to medical. I'm sorry, we're fixing my computer. However, much more is needed to ensure our veterans are not deprived of their necessities beyond the pandemic, which has highlighted how critical these basic needs are to helping veterans obtain a substantial and permanent safe housing. This legislation will ensure that the Department of Veterans Affairs can permanently use funds more effectively to support the needs of homeless veterans. The Secretary of the Department will be responsible for allocating the funds appropriately. The funds can be used to provide food, clothing, or shelter, transportation, or communications equipment, such as tablets, disposable phones, or smartphones. In addition, the Secretary can also use lands available to the Department of Veterans Affairs to assist homeless veterans in finding shelter, and may collaborate with other organizations to provide any of the assistance that the amendment authorizes. Too many of our nation's veterans have returned home from serving the country and lack access to housing and other basic needs. I welcome the committee to support the passage of HR 8003. Thank you so much. I yield back my time.
Well, thank you, Representative Sherflis McCormick. And Senator Johnny Isaacson and Representative David P. Rowe Healthcare and Benefits Improvement Act of 2020, Congress authorized VA to spend funds on basic needs for homeless veterans, such as food, transportation, shelter, communication equipment, and clothing during the covered public health emergency caused by COVID-19. Now, prior to Isaacson Rowe, VA had no authority to use funds in this manner. Community organizations and nonprofits were left to fill in these gaps for essentials for homeless veterans in need. The legislation offered by Representative Sherflis McCormick will permanently authorize VA to provide homeless veterans with these basic needs to ensure their survival, safety, and health. Her bill is a long-needed change in policy that will allow VA to expend funds for essentials. By meeting the foundational elements of a veteran's well-being, we keep them, we help them thrive and prosper. This bill is particularly important for veterans residing in rural areas where it is often harder to reach services and resources. We cannot reasonably expect a veteran experiencing homelessness to transition to permanent housing and a stable livelihood without access to basics such as food, clothing, and transportation. Last week, I participated in the Economic Opportunities Subcommittee field hearing on veteran hunger in San Diego with Chairman Levin, where we discussed the importance of nutrition to our veterans' health and well-being. This bill will ensure that our most vulnerable veterans don't go hungry while they wait for permanent housing. The communication devices and data plans VA can purchase through this authority are a critical lifeline to health care and resources that are otherwise impossible for homeless veterans to access. To date, VA has used $3.5 million to pay for essentials for nearly 30,000 veterans through this authority. That comes out to just $120 per veteran. The authority has also been used to pay for over 132,000 rides for the nearly 27,000 homeless veterans to get them to and from medical appointments and job interviews for an average of $37 per ride. But the value added here is about much more than dollars and cents. It's about access to the basics to restore veterans' dignity. Permanently authorizing these flexibilities for VA will help homeless veterans secure the wraparound resources they need to get them and to keep them stably housed. This bill is supported by Disabled American Veterans, National Alliance to End Homelessness, National Coalition for Homeless Veterans, Maison, Bento, and the Veteran of Foreign Wars. Now, is there any further debate or discussion on H.R. 8003. Ranking Member?
Thank you, Mr. Chairman. Unfortunately, I am unable to support this bill. While I understand the intention of the gentlelady from Florida, I am worried that we could be making a hasty decision on moving this bill at this time. VA and community providers have made significant progress in reducing homelessness among veterans, and there is no doubt that COVID-19 pandemic had a significant impact on the homeless veteran population. Congress rightly gave VA additional authority to help provide food, clothing, shelter, and transportation to assist homeless veterans during the pandemic. These authorities are normally outside the level of service the VA directly provides. The bill before us today would permit permanently extend the authority, and I am not sure if that is what the right thing to do at this time. CBO has established that the bill will cost $30 million over the next 5 years. I believe that these funds could be better spent on the service for veterans. We also know that some of the funds that have been used at an emergency basis are outside of how many Americans believe their taxpayer dollars should be spent. For example, the VA Office of Inspector General found that the VA spent $7 million to provide homeless veterans with new iPhones, which included a full year of data plan. While it is commendable that the VA was trying to help improve communication operation for homeless veterans, the idea proved to be flawed. I believe that there is a better way to connect homeless veterans with the benefits and services they need. I look forward to working with my colleagues to look for ways to improve services for homeless veterans, but I believe this bill is missed the mark as it stands, and with that, I yield back.
Well, thank you, Representative Brownlee. Thank you, Chair, Ranking Member Bost. Is there any further debate on H.R. 8003? If not, I'm going to recognize Representative Brownlee for a motion.
Mr. Chairman, I move that H.R. 8003 be reported favorably to the House.
All those in favor will say aye.
Aye.
Any opposed will say no. In the opinion of the chair, the ayes have it, and the motion is agreed to. Without objection, the staff is authorized to make necessary technical and conforming changes in the committee amendments.
Mr. Chairman.
Ranking Member Bost.
Pursuant to House Rules 11, Clause 2, I give notice of intent to file minority or supplemental additional and/or dissenting views on H.R. 8003.
Without objection, so ordered. The committee will now proceed to the consideration of H.R. 8215. The clerk will please designate the bill.
H.R. 8215.
The text was circulated in advance pursuant to committee rules. Without objection, the first reading is dispensed with, and I now recognize Representative Slotkin for 5 minutes to discuss her bill.
Thank you, Mr. Chair. I'm here to talk about the Veterans Online Information and Cybersecurity Empowerment Act of 2022. I want to take some time to discuss the two issues that I remain focused on and that I think this bill really covers. One is helping Americans across society, and in particular veterans, build their cybersecurity practices so that they can protect their own data and the data of their families. And then secondly, in our digital society that we live in, equipping our Americans, citizens with the tools and knowledge they need to recognize, discern, and combat purposeful mis- and disinformation. So we know that veterans rely in particular on social and digital media to make decisions about all aspects of their lives, from employment, healthcare and wellness, family choices, democratic engagement. And like many other parts of society, this has made them targets for foreign actors, for scammers who are attempting to manipulate and influence their behavior. First and foremost, according to the Federal Trade Commission, fraud cost veterans, service members, and their families $267 million in 2021. And the loss to a veteran and their families was 20% higher than the average loss for the general public due to fraud. The Vietnam Veterans of America put out a study in 2020 that noted that veterans are targeted by foreign actors at higher rates than the average society because of their positive views in society. People admire their service, they're trusted agents, and they vote in high numbers. An Oxford University study in 2016 was also undergirds that idea, saying that Russia exploited social media platforms to target and engage U.S. military veterans and active duty troops with anti-government propaganda, conspiracy theories, and other disinformation. The content produced by websites targeted veterans and troops on both sides of the political spectrum with the intent of undermining trust in U.S. democracy. Veterans are twice as likely to unknowingly participate in scams, as we mentioned, many of which happen in the cyber domain compared to the general public. And because of that, over the last few weeks, we've been working with the Department of the VA and this bill, and it's complementary to many of the ongoing efforts that others have spoke to today, including existing cybersecurity partnerships with the United States Postal Inspection Service and the Cybercrime Support Network. But there's more work to be done. From my vantage point, the Committee on Homeland Security and this committee, there are a bunch of overlapping opportunities for more collaboration, to take what we know about threats across our society and translate them into educational programs for our veterans. That's why I'm introducing this bill today. It'll create a VA grant program to ensure veterans can safely and responsibly use the communication tools and platforms that they're often required to use, and ensure that men and women who served our nation are ready to face these real cyber threats. And just as a reminder, 60% of our nation's veterans are over the age of 60, never received that mandatory annual course as active duty members, never got any training in cybersecurity, never had any safety awareness. So this would help get at that problem and make sure our veterans are not victims of disinformation, misinformation, and financial cyber scams. With that, Mr. Chairman, I yield back.
Well, thank you, Representative Slotkin. Representative Slotkin's Veterans Online Information and Cybersecurity Empowerment Act of 2022, or the VOICE Act of 2022, responds to the increase in disinformation and foreign influence on online forums. It would create more pathways for veterans to learn the foundational skills that can help them get good jobs, helping protect our communities from cyber threats. Veterans in the United States rely on information from social and digital media to make decisions about all aspects of social, economic, and political life. This may include information on employment, career and professional development, family and leisure choices, health and wellness, and democratic engagement. According to the Federal Trade Commission, fraud costs veterans, service members, and their families $267 million in 2021. This was a 162% increase from 2020, and median loss for these scam victims was $600, 20% higher than the median loss for the general public. Also, according to a 2017 survey conducted by the American Association of Retired Persons, veterans are twice as likely to unknowingly participate in scams, many of which are cyber scams compared to the general population. This bipartisan legislation is a common-sense approach to work with VA and DHS to better prepare our veterans for cyber threats. I urge my colleagues to support 8215. Is there for HR 8215? Is there further debate on HR 8215?
Mr. Chairman. Yeah, thank you, Mr. Chairman. Unfortunately, I'm going to oppose this bill as it's currently written. While I agree with its importance to help veterans educate themselves about how to be safe online, I believe this bill goes too far in the fact that the focus of the bill is to have VA provide grants to several organizations to help veterans protect themselves. I am concerned that the definition of who can be provided with grant funding and what type of services can be provided may veer into too close to defining disinformation. This could be construed to infringe on the First Amendment. I understand that this is not Congresswoman Slotkin's intention at all. However, it is still a legitimate concern given the Biden administration's recent efforts to limit speech with the President's Disinformation Governance Board. And I also do not believe that the VA has the capacity or expertise to make this decision on the types of grants that would be funded by this bill. This is the type of program that should be funded through the Department of Homeland Security, not the VA. Finally, I believe that we shouldn't listen to VA's, I believe we should listen to VA's concerns about waiting for the department to determine what authorities the Secretary has under current law to protect veterans from cyber crimes before we give them even more work to do. So I urge all my members to oppose that, this bill, and I yield back.
Well, thank you, Ranking Member Bost. Is there any further discussion on the legislation?
Mr. Chair.
Ranking Member Rosendale.
Thank you, Mr. Chair. When I was reading through this bill, it struck me, do we trust our veterans at all? I've never seen any piece of legislation that is so demeaning and paternalistic. This bill would require the VA to teach veterans, and I quote, critical thinking and problem-solving skills, and understanding how media and digital content may influence ideas and behaviors. I'm sorry, but this sounds like you're herding a bunch of vets into a third-grade computer lab. And frankly, that's a charitable interpretation. This bill, if passed, would almost certainly play into a negative stereotype of extremist veterans who need to be deprogrammed from their radical views by the all-knowing wise men of Congress and the federal government. What will the public think when the VA stands up a program to handhold our veterans through internet literacy to save them from misinformation? Even more importantly, what will the veterans think when the administration that's supposed to care for their physical and mental health treats them like vulnerable children who can't be trusted with the internet? I have no trust for the federal government to control information versus misinformation. And I don't think I'm going to go out on a limb to say that most veterans don't either. Mr. Chairman, I don't only oppose this bill, I believe this bill will be harmful to our veterans and sow more distrust between them and the VA. I yield back.
Is there further discussion on the on HR 8215?
Mr. Chairman.
Mr. Roy.
I thank the chairman. I won't use my entire time on this. I associate myself with my friend Mr. Rosendale's comments. Yeah, I mean, look, and I'll just kind of make it a little bit simpler. I look down, straight down on every amendment. My staff, I going to give me the list. I look down at cost. $20 million for each fiscal year, 2022, 24, 26, for $60 million over 5 years. At what point do we just keep throwing money at whatever idea one of us has? I mean, it's just insane. We just keep doing it. It's like, oh, I've got an idea. Somebody raised something to me once. And I associate myself with the gentleman's comments about why I think this is problematic. But it's just another $60 million. I mean, like, well, it's $30.5 trillion. What's $60 million? $60 million is like, me dropping a penny on the floor, I guess. But it's still a penny, right? Penny saved, a penny earned. I just don't know at what point we're going to actually do the job that we're supposed to do to make decisions of guns versus butter, of balancing the budget, of the hard things we do at home. Not one of us goes home and says, man, I really want to take that vacation, buy that new car, send my kids to that school. We don't go down and just list and just go say, well, whatever I want, right? We have to say, well, what's the budget? But we literally never do that. And with all due respect, I'd say that my colleagues on the other side of the aisle hide behind, well, we should just pass more tax increases. Never mind what that would do economically speaking, but fine, at least we could have that debate. Our side of the aisle, we say, well, we're not going to touch tax increases, but we need to be better on our side of the aisle about spending. But we can't just write blank checks. This is $60 million for a program which not only to me has no discernible benefit, but actually is harmful and interferes with First Amendment protections, and this whole notion of disinformation and continued training. So for those reasons and others, I will oppose the amendment.
Thank you, Mr. Roy. Any further discussion on HR 8215? If not, I will recognize Ranking Member, Chairwoman Brownlee for a motion.
Mr. Chairman, I move that H.R. 8215 be reported favorably to the House.
All those in favor will say aye.
Aye.
Any opposed will say no.
No.
Oh.
In the opinion of the chair, the ayes have it, and the motion is agreed.
Mr. Chairman. I request a recorded vote.
The recorded vote has been requested. Is there a sufficient second?
Second.
There is a sufficient second. A recorded vote is ordered pursuant to Rule 4. Further proceedings on the measure will be postponed. We will now consider H.R. 6647. The clerk will designate the bill.
H.R. 6647.
Text was circulated in advance pursuant to committee rules without objection. The first reading is dispensed with. The bill will be reconsidered. The bill will be considered as read and open to amendment at any point. I now recognize Ranking Member Boss for 5 minutes to discuss his bill.
Thank you, Mr. Chairman. H.R. 6647 would provide 60-day grace period for newly enrolled veterans to ensure that they are eligible for reimbursement from VA in the event of an emergency. VA reimbursement versus veterans for emergency care services received in non-VA facilities for conditions unrelated to the veteran's military service only if the veteran is an active VA patient. VA considered considers an active patient one who has had at least one VA healthcare appointment in the previous 24 months. Veterans who are newly enrolled in the VA care may not have had the opportunity to receive that first VA healthcare appointment. This bill would give veterans who are new to the VA the peace of mind to know that they are covered should disease strike before they are able to see a VA doctor. Unfortunately, we know that this can sometimes take far too long due to the extensive wait times and other access issues. This is a common sense bill, and I fully support it. And with that, Mr. Chairman, I yield back.
Well, thank you, Ranking Member Bost. H.R. 6647, the Relieve Act, will allow veterans who first enrolled in VA healthcare within the last 60 days to be covered for emergency care in the community, even if they have yet to receive any services from a VA provider. Existing VA authorities for coverage of emergency care in the community are extremely complex. They are also not well understood by veterans who often end up blindsided by massive medical bills they can't afford. Now, under current law, VA can only cover emergency care in the community for a non-service connected condition if the veteran was enrolled in VA healthcare and had used VA care within the 24 months prior to the emergency care episode. This bill would make an exception for veterans who first enrolled in VA healthcare within the 60 days prior to their emergency care episode. Such veterans may not have had a reason to use VA care yet, or they may have experienced a wait time for a routine appointment. Now, I support this bill, and I encourage my colleagues to do the same. Is there further debate on H.R. 6647? I understand Chairman Pappas would like to be recognized to speak on this bill. Chairman Pappas.
Sure. Thank you very much, Mr. Chairman. I just wanted to add my comments in favor of H.R. 6647, the Relieve Act. It's a strong bipartisan bill. And just to echo the comments of the chairman and the ranking member, it's really just unacceptable to require veterans to jump through so many hoops to make sure that their health care is covered at VA, especially in the case of an emergency. So we know that under current law, a veteran must have received VA-provided health care within 2 years in order for VA to reimburse for non-VA emergency care. But this is really an arbitrary rule, and a lot of veterans have got caught up in it, and I've heard about it very directly from them. Veterans that either are hit with an unexpected bill for seeking non-VA emergency care, or veterans that don't seek care in the case of an emergency because they're worried that a bill might come if they go to an emergency room that's outside of VA's outside of the VA system. So that's why I've helped introduce this bill. It would expand non-VA emergency-related health care for veterans who are enrolled in VA health care during the last 60 days. I think it's a common sense measure. Glad this has bipartisan support, and I urge everyone to support it today. I yield back.
Well, thank you, Chairman Pappas. Is there further discussion on H.R. 6647? If not, I recognize Ranking Member Bost for a motion.
Thank you, Mr. Chairman. I move that the committee report H.R. 6647 favorably to the full House of Representatives.
All those in favor will say aye.
Aye.
Aye. Any
opposed will say no. In the opinion of the chair, the ayes have it, and the motion is agreed to. Without objection, the motion to reconsider is laid on the table. Without objection, the staff is authorized to make necessary technical and conforming changes in the committee's amendments.
Mr. Chairman.
Ranking Member Bost.
Mr. Chairman, pursuant to House Rule 11, Clause 2, I give notice of intent to file minority or supplemental additional or dissenting views on H.R. 6647.
Without objection, so ordered. We'll now consider H.R. 5606. The clerk will designate the bill.
H.R. 5606.
The text was circulated in advance pursuant to committee rules. Without objection, the first reading is dispensed with. Without objection, the first reading and this bill will be considered as read and open to amendment at any point. Without objection, a statement from the bill's sponsor, Representative Williams, and associated letters in support of the bill will be included in the record. I now recognize myself for 5 minutes. Congresswoman Williams' bill, H.R. 5606, permanently adjusts the maximum per diem rate for providers who shelter and deliver services to veterans transitioning out of homelessness through the VA grant and per diem or GPD program. GPD is a critical component of the spectrum of services and programs VA provides veterans experiencing or at risk of homelessness. The result of GPD programs is that veterans achieve residential stability, increase their skill levels and income, and obtain greater self-determination as they secure permanent housing. In Isaacson Row, we raised the per diem rate to 115% of the state domiciliary rate, and the American Rescue Plan provided a 300% rate through the public health emergency caused by COVID-19. Started last year, VA was able to begin providing higher per diem payments for veterans who have care of minor dependents in GPD programs. This increased support reduces barriers for organizations to be able to serve veterans and their families as they transition back to permanent housing. The pandemic has shown us the value and impact of the services providers can deliver to homeless veterans when a higher rate is in place. Requests for increases to the per diem rate date back to well before the pandemic, as cost of living and affordable housing shortages have increased nationwide. GPD providers have long needed safer, more individualized space for transitional housing, but they do not apply for capital grants that would help fund expansion because they would not be able to afford to staff the additional space without increased per diem rates. This legislation brings GPD much closer to being able to provide transitional housing for all eligible veterans nationwide until permanent housing can be secured. This language was included in Senator Tester's bipartisan S-2172, the Building Solutions for Homeless Veterans Act, which passed unanimously out of the Senate Veterans Affairs Committee. This bill is supported by the National Coalition for Homeless Veterans, National Alliance to End Homelessness, the American Legion, and Disabled American Veterans. I urge my colleagues to support this bill. Is there further debate on H.R. 5606? Ranking Member Boss?
Mr. Chairman, thank you, Mr. Chairman. Unfortunately, I will also have to oppose this bill at this time. As I mentioned earlier, we know that the COVID-19 pandemic impacted homeless veterans, providers, and the population that they serve. To address concerns about the health and safety of homeless veterans congregated in a congregated setting is 2020, Congress rightly increased the rate provided to providers through the grant and per diem program. This amount is funded at 85% of the current amount authorized by law before the CARES Act was enacted to 200% of the current domiciliary care. The 85% increase funded the cost of lodging for homeless veterans, COVID testing, additional PPE, and other services. The bill would make that increase to 200% at a cost of $800 million in discretionary funds over the next 5 years. While I agree we may need to increase the grant and per diem rate, I am not convinced that the 200% number is warranted after the COVID-era services have ended. Now, I believe we need to have a larger conversation with stakeholders, VA, and our friends on the Appropriations Committee before we agree to a 115% increase in funding. I look forward to continuing those conversations with our colleagues, and I urge our members to vote no on the bill for meantime sake, and with that, I yield back.
Thank you, Ranking Member Boss. I am going to recess the committee for votes. I ask that members vote quickly and return so that we can reconvene. We'll be in recess subject to the call of the chair.
Testing on Zoom, 1, 2, 3, 4, 5. Just testing that the room can hear.
All right, Daniel, we can hear you. This is test 1, 2, 3. Mic test 1, 2.
Thank you.
Could we have all members who are joining us on the virtual platform, please show your face on camera. We need to have your face on camera in order to establish a quorum. So the committee rules are that not only do your cameras have to be turned on, you have to be in view. If you're out of sight, you don't count for the purpose. I now call the committee back to order. And we were finishing debate on H.R. 5606. There being no further debate, I now recognize Chairwoman Representative Brownlee for a motion.
Mr. Chairman, I move that H.R. 5606 be reported favorably to the House.
All those in favor say aye.
Aye.
Opposed, say no. In the opinion of the chair, the ayes have it, and the motion is agreed to. Without objection, the motion to reconsider is laid on the table. Without objection, the staff is authorized to make necessary technical and conforming changes in the committee amendments.
Mr. Chairman.
Ranking member.
Mr. Chairman, pursuant to House Rule 11, Clause 2, I give notice to intent to file minority or supplemental, additional, or dissenting views on H.R. 5606.
Without objection. We will now consider H.R. 5776. The clerk will designate the bill.
H.R.
The
5776.
text was circulated in advance pursuant to committee rules. Without objection, the first reading is dispensed with. The bill will be considered as read and open to amendment at any point. I now recognize myself. This bipartisan bill, H.R. 5776, establishes a Center for LGBTQ veterans within the Department of Veterans Affairs. And I thank Representative Kahele of Hawaii for introducing this bill. The center will serve as the principal advisor to the Secretary of Veterans Affairs on policies and programs affecting the estimated 1 million veterans who identify as LGBTQ. For more than 10 years, or more than 10 years after the repeal of the military's harmful Don't Ask, Don't Tell policy, LGBTQ veterans continue to report worse health impacts compared to their heterosexual peers, as was evidenced by last month's release of the department's first ever chart book of lesbian, gay, and bisexual veterans' primary health care experiences. Similar to VA's Center for Minority Veterans and Women Veterans, the Center for LGBTQ Veterans will help ensure that these veterans have full and fair access to the services and benefits they've earned. H.R. 5776 is endorsed by over a dozen VSOs and other organizations, including the VFW, American Legion, Modern Military Association of America, and Minority Veterans of America. I urge all of my colleagues to support this meaningful legislation. Is there further debate or discussion on H.R. 5776?
Mr. Chairman.
Ranking Member Bost.
Thank you, Mr. Chairman. I oppose H.R. 5776. VA has taken several steps under its own authority to assist veterans, including putting counselors in every medical center. The bill would not add any capacity or capability that the department is not already utilizing. Additionally, VA raised concerns about the drafting of this bill. This version does not reflect any change that the VA has requested. Therefore, I do not support the bill, and I yield back the balance of our time.
Well, thank you, Ranking Member Bost. Is there further discussion on the legislation? Ranking Member, Chairwoman Brownlee?
No.
No? Okay. If there's no further discussion, I recognize Chairwoman Brownlee for a motion.
Mr. Chairman, I move that H.R. 5776 be reported favorably to the House.
All those in favor will say aye.
Aye. Aye.
Those opposed will say no.
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 In the opinion of the chair, the ayes have it, and the motion is agreed
Mr.
to.
Chairman, I ask for a recorded vote.
A recorded vote has been requested. Is there a sufficient second? There is a sufficient second. A recorded vote is ordered pursuant to Committee Rule 4. Further proceedings on the measure shall be postponed. We will now proceed to consideration of H.R. 6823. The clerk will designate the bill.
H.R. 6823 to amend Title 38.
Text was circulated in advance pursuant to committee rules. Without objection, the first reading is dispensed with, and I recognize Ms. Brownlee to offer her amendment.
Mr. Chairman, I have an amendment in the nature of a substitute to H.R. 6823 at the desk.
The clerk will designate the amendment in the nature of a substitute.
Amendment in the nature of a substitute.
Text was circulated in advance pursuant to committee rules. Without objection, the reading of the amendment is dispensed with, and the substitute will be considered as original text for the purposes of amendment. Chairwoman Brownlee, you're recognized for 5 minutes in support of your amendment.
Thank you, Chairman Takano. I appreciate that this legislation has been brought forward today. As we previously discussed at the legislative hearing, my bill will enable aging and disabled veterans to receive the support they need to live at home. It expands several existing VA programs that are evidence-based, cost-effective, and consistently in high demand among aging veterans. Research shows aging veterans' health outcomes are better when they have the choice to stay home and receive the care and support that they need to age with dignity. Expanding access to the programs in this legislation means we can delay, if not prevent, a veteran from needing institutional care. When we support veterans staying in their homes, it means families can stay together, caregivers have the support they need, and communities remain connected and intact. This bill will also serve as a long-term solution to much of the pain around the changes to the program of comprehensive assistance for family caregivers. While I support the recent changes made by VA to suspend discharging veterans and their families from the caregiver program, many of the home care programs expanded under my bill may be a better fit for aging and disabled veterans and their caregivers who may not be able to enroll in the comprehensive caregiver program. For these other VA programs, there is no service connection requirement, only medical need. In addition to expanding existing home and community-based programs at VA, this legislation will raise the cap on how much the VA can pay for the cost of home care, create coordination between VA home care programs, the VA Caregivers Program, and Medicare's PACE program, review service gaps in VA geriatric and extended care, provide respite care to caregivers in VA home care programs, and create a one-stop shop on VA's website where veterans can easily navigate the home and community-based resources available to them. Additionally, the ANS addresses minor feedback and technical assistance from VA and other stakeholders. It's also garnered the support of many VSOs and advocacy groups representing aging and disabled people, in part because this legislation is no half measure. If enacted, this bill will make systemic improvements to how we care for aging and disabled veterans in this country. Our veterans deserve no less. Finally, developing this bill with a bipartisan team, advocates from groups with decades of expertise like the Paralyzed Veterans of America, Disabled American Veterans, and the Elizabeth Dole Foundation worked with us to refine and perfect this piece of legislation. And specifically, I'd like to extend my sincerest thanks to Senator Elizabeth Dole. I am sure she is watching this hearing. Her tireless efforts on behalf of veterans and their family caregivers continue to be an inspiration. Thank you again, Mr. Chairman. I urge my colleagues to vote yes on the bill, and with that, I yield back.
Well, thank you, Chairwoman Brownlee. I commend Subcommittee Chairwoman Brownlee for her leadership on H.R. 6823, the Elizabeth Dole Home and Community-Based Services for Veterans and Caregivers Act. Hello to Senator Dole. I know you are watching, as Ms. Brownlee has said. I salute you also for your tremendous work in this policy space. I have great admiration for you, as well as Senator Dole, the other Senator Dole. VA has not been moving as fast as the states have in terms of shifting its investments from institutional programs to non-institutional programs. This legislation will expand access to a variety of VA programs for elderly and disabled veterans, enabling them to remain at home, safely age in place, and avoid or delay admission to nursing homes and other costly institutional settings of care. In addition, this legislation will help connect veterans, caregivers to respite care and other supportive services that help them care for veterans at home. It will also improve VA's coordination with other federal long-term care programs that promote aging at home. And finally, this bill will require VA to create a website where veterans and their families can more easily obtain information about VA's home and community-based services programs and assess whether any of these programs may be right for them. I strongly support this legislation and urge my colleagues to support it as well. Does any other member wish to be recognized to discuss the amendment in the nature of substitute to H.R. 6823, Ranking Member Bost?
Thank you, Mr. Chairman. You know, the amendment in the nature of substitute to H.R. 6823 would make numerous improvements to VA home and community-based services and long-term care programs. Almost half of the more than 9 million veterans who are enrolled in the VA healthcare system are 65 years old or older. These veterans are increasingly in need of long-term care, and a growing number of them prefer to remain at home if able. Home and community-based services support independence and are more cost-effective than the institutional care. And the annual per-veteran cost for nursing home care, with it being 8.6 times higher than the home-based care. You know, Senator Elizabeth Dole, who, as each one of us has mentioned, you know, she's dedicated her life out of elected office to champion the cause of caregivers and ensuring that veterans and all Americans can maintain their dignity and independence even through the most difficult disabilities and illnesses. This amendment in the nature of a substitute is appropriately named. And I want to thank Congresswoman Brownlee and Congressman Berkman for introducing this bill. It has my full support, and with that, I yield back.
Well, thank you, Ranking Member Bost. Is there any further discussion on HR 6823? If not, the question is now on the Brownlee amendment in the nature of a substitute to HR 6823. Excuse me.
We're without a quorum.
Oh, gosh. All right. We need to, members, I encourage you to,
We need a couple more on.
we need a couple more on. How many do we need?
All right, there's one. We need, that's 14, yeah. That's pretty funny. I almost brought that up. Now we're good. All right.
Thank you, Ms. Luria, for joining us.
So
All
you're
right.
ready for my motion, right?
Yes, I am.
Okay.
No, wait. If not, the question is now on the Brownlee amendment in nature substitute to HR 6823. All those in favor, please say aye.
Aye.
All those opposed, say no. In the opinion of the chair, the ayes have it, and the Brownlee amendment in nature of substitute is agreed to. Without objection, the motion to reconsider is laid on the table. Is there further debate on HR 6823? If not, I now recognize Ranking Member Bost for a motion.
Mr. Chairman, I move the committee report H.R. 6823 as amended favorably to the full House of Representatives.
All those in favor will say aye. Aye. All those opposed say no. In the opinion of the chair, the ayes have it, and the motion is agreed to. Without objection, the motion to reconsider is laid on the table. Without objection, the staff is authorized to make necessary technical and conforming changes in the committee amendments.
Mr. Chairman, pursuant to House Rule 11, Clause 2, I give notice to intent of filing a minority or supplemental, additional, or dissenting views on H.R. 6823 as amended.
Without objection, so ordered. We'll now move to consider H.R. 3693. The clerk will designate the bill.
H.R. 3693.
Text was circulated in advance pursuant to committee rules. Without objection, the first reading is dispensed with, and I recognize Chairwoman Brownlee to offer an amendment.
Mr. Chairman, I have an amendment in the nature of a substitute to H.R. 3693 at the desk.
The clerk will designate the amendment in the nature of a substitute.
Amendment in the nature of a substitute.
Text was circulated in advance pursuant to committee rules. Without objection, the reading of the amendment is dispensed with, and the substitute will be considered as original text for the purposes of amendment. Chairwoman Brownlee, you are recognized for 5 minutes in support of your amendment.
Thank you, Mr. Chairman. This legislation will expand VA's existing continuing professional education, better known as the CPE benefit, from only board-certified physicians and dentists to other types of VA clinicians. Most states require clinicians to obtain a certain number of continuing education hours on an annual basis to enhance clinical knowledge and competencies and as a condition of maintaining licensure or certification. The ANS will make it possible for tens of thousands of VA clinical employees to receive an annual allowance to cover course fees, supplies, transportation, lodging, and meals associated with earning the continuing education credit. The ANS provides the CPE benefit to the following occupations, which were selected on the basis of past VA Office of Inspector General findings about VA's clinical staffing shortages: physicians, dentists, podiatrists, registered nurses, physician assistants, psychologists, licensed practical or vocational nurses, medical technologists, diagnostic radiologic technologists, and social workers. While the original bill would have extended the benefit to every clinical occupation, the ANS will ensure that the benefit is targeted to VA's hardest to recruit and hardest to retain clinical occupations. The ANS also adjusts the amount of the CPE allowance that covered healthcare professionals would be eligible to receive each year. Currently, VA's CPE allowance for physicians and dentists is capped at $1,000 per year and has not been updated since the benefit was first enacted in 1991. This legislation will provide VA the authority to increase the amount of its CPE allowance in the future to help keep pace with similar benefits offered in the private sector. While the original bill would have made physicians and dentists eligible for a higher amount, the ANS sets the allowance at $2,000 per year for all covered occupations. VA requested that we provide the same amount to all covered occupations so as to promote equity between the professions and to simplify the administration of the benefit. Narrowing the group of covered occupations and reducing the maximum amount that physicians and dentists will be eligible to receive also helps address concerns raised by the minority about the overall potential cost of the original bill as introduced. Unfortunately, I understand that Representative Miller-Meeks, hello, Ms. Miller-Meeks, I see you there, will not be supporting the ANS. This is unfortunate given we introduced the VA CPE Modernization Act together last year. My understanding is that Representative Miller-Meeks is concerned that physicians would be receiving the same amount as other employees under the ANS and is also concerned about the overall potential cost of the legislation. I'm sorry we could not reach consensus, but I believe it's imperative that we invest in VA's clinical workforce. Veterans deserve world-class health care, and the VA's CPE Modernization Act will help keep VA's clinical employees at the cutting edge of their professions. This benefit will be particularly meaningful to employees who are less well compensated than physicians who have never before been eligible for VA reimbursement of continuing education expenses. Our bill has the support of 19 bipartisan co-sponsors, a wide range of veteran service organizations, several healthcare provider associations, and other stakeholders. I urge my colleagues to join us in supporting this important legislation, which will help make VA a more competitive employer while enhancing the clinical knowledge of VA healthcare professionals. Thank you again, Mr. Chairman, and with that, I yield back.
Well, thank you, Chairwoman Brownlee. H.R. 3693, the VA CPE Modernization Act, will expand existing VA program that reimburses VA healthcare professionals for their continuing professional education or CPE expenses. VA CPE benefit provides reimbursement for course fees, course supplies, transportation, lodging, and meals, and incidental expenses. H.R. 3693 will expand this benefit from only board-certified physicians and dentists to a broader group of clinicians and remove the board certification requirement. It will also increase the amount of the annual CPE allowance that covered healthcare professionals would be eligible to receive and provides authority for the Secretary to increase the amount of the benefit in the future. The amount of the current allowance has not been increased since the benefit was created more than 30 years ago. I urge my colleagues to join me in supporting this critical legislation, which will help VA better recruit and retain healthcare professionals and improve its competitiveness with private sector employees. Does any other member wish to be recognized to discuss the ANS or the amendment in nature of substitute to H.R. 3693?
Mr. Chairman.
Ranking Member Bost.
Thank you, Mr. Chairman. I appreciate the work Congresswoman Brownlee and Dr. Miller-Meeks have done on this legislation, but I'm unable to support it today. You know, just last week, the House voted to spend $5.7 billion in the PACT Act to support and expand VA workforce. We need to see and assess the impact that investment has before we think about spending an additional $1 billion on the recruitment and retention. I also share the concerns of Dr. Miller-Meeks has about providing the same continuing professional education reimbursement for docs, dentists, and other healthcare professionals. Training requirements are expensive for physicians, outpace those of other healthcare staff. The level of reimbursement they receive for continuing professional education should reflect that. For these reasons, I will oppose the amendment today, and with that, Mr. Chairman, I yield back.
Thank you, Ranking Member Bost. Are there any other members who wish to speak? Representative Miller-Meeks, you're recognized for 5 minutes.
Thank you, Chair Takano and Ranking Member Bost. And I'm a proud co-leader of the VA CPE Modernization Act. And I'd also like to thank Congresswoman Brownlee for her leadership on this important issue. As a 24-year veteran, a nurse and a physician, it's one of my main priorities in Congress to ensure that all veterans have high quality care, which means recruiting and retaining the best and brightest doctors, nurses, physician's assistant, dentists, and other healthcare professionals to the VA. Providing reimbursement of continuing professional education expenses, or CPE, is an important way to do that. However, I'm unable to support the ANS to the CPE Modernization Act. This AMS reimburses all healthcare professionals at the same level for CPE expenses. Having been both a nurse, married to a nurse, and a physician, I know firsthand the amount of work and the cost of continuing education. And this is before online education. I know the cost of education, the cost of licensure, and the burden that physicians have in order to have licensure and be at the VA with board certification, which is not required for other professions, and the cost of board certification, and the fact that it is an every 10-year renewal process. So being a physician requires more education, training requires more intensive and costly certifications. And as you have said already, both Ms. Brownlee and Chair Takano, this has not been updated in any bill for over 30 years. For this reason, I do not believe it's appropriate for physicians to receive the same CPE reimbursement as it is for other healthcare professionals whose cost of CPE and obtaining credits is significantly less. I agree we should provide reimbursement to non-physician healthcare workers, fully in support of that, which is why I was a co-sponsor of this bill. However, we should tailor the reimbursement rate to match the reality of what's required in our healthcare workforce. The intention is to be able to recruit and retain, and already we have a challenge with our most difficult to recruit and retain members, and that's our physician workforce. This bill does not do that, and I cannot support it in its current form. Thank you very much for Chairwoman Brownlee for working with me to try to improve the bill, and I regret that we were not able to find some common ground. I'll be voting against HR 3693 in its current form, but I truly hope that we can continue to work on this bill to find a solution that's agreeable to all of us. Thank you, and I yield back.
Well, thank you, Representative Dr. Miller-Meeks. Are there any other members who wish to speak? Mr. Rosendale.
Thank you, Mr. Chair.
You're recognized for 5 minutes.
Thank you very much, Mr. Chair. There have been numerous bills reported out of this committee that have authorized tens upon tens of millions of dollars for workforce development purposes. And yet, this bill would add an additional nearly $2 billion of spending at a time of record inflation, all in the name of recruitment and retention of VA staff. Unfortunately, this legislative body can only think of problems in terms of how many dollars are not being spent. Could it possibly be that the dollars aren't being spent in the right place? Granted, the technology modernization hearing on EHRM is next week, but I will say that this Cerner debacle has not only cost us tens of billions of dollars, but it's also cost us untold thousands of man-hours spent trying to find workarounds for this VA vanity project, and as a result, staff morale has been abysmal, and no amount of continuing education dollars is going to resolve that. This is just an example, but if we're going to help the VA staffing issue, then at some point, we have to stop asking the American taxpayer to spend more money and start asking if misguided government bad decisions are what's making VA's lives miserable. We've already authorized the money for workforce development. Let's let that play out and consider other solutions before we vote in nearly $2 billion for this bill. Thank you very much, Mr. Chair. I yield back.
Thank you, Mr. Rosendale. Does any other member wish to be recognized to discuss the amendment in nature of substitute to H.R. 3693? If not, the question is now on the Brownlee amendment in nature of substitute.
Mr. Chairman, we need
3693.
people to be on the screen again. We're missing.
For all the members that are joining us virtually, let's we need to see your,
All right, thank you.
is that, do we now have a quorum? Oh, Ms. Capter. We had it for a moment, so we need at least one more member to return back to the screen.
Is Ms. Luria right near her?
Ms. Luria, if you're near your camera, please show up on camera, or Ms. Capter, we need at least one more member. We need two, we need both. We need two members to,
The screens are on, they're just not staying in front of them.
Ms. Capter is back.
I think it's coming to your office to tell you. Here.
Ms. Capter was back for a moment. I was going to quickly get a vote in. So, hearing no other members wishing to be recognized, the question now is on the Brownlee Amendment in nature of substitute to H.R. 3693. All those in favor say aye.
Aye.
Aye. Any opposed say no. No. Any opinion of the chair is the ayes have it, and the Brownlee Amendment in the nature of substitute is agreed to.
Mr. Chair, I request a recorded vote.
So a recorded vote is requested. Is there a sufficient second? There is a sufficient second. A recorded vote is ordered pursuant to Committee Rule 4. Further proceedings on the measure shall be postponed. Yeah. No, Ranking Member, do you wish to file a?
No, it stops on that.
We stop on it. Okay. That's right. I now call up H.R. 291. The clerk will please designate the bill.
H.R. 291.
Text was circulated in advance pursuant to committee rules. Without objection, the first reading is dispensed with. I now recognize Ranking Member Boss to offer an amendment.
I have amendment, thank you, Mr. Chairman. I have an amendment in the nature of a substitute at the desk.
The clerk will designate the amendment in the nature of substitute.
Amendment in the nature of a substitute.
The text was circulated in advance pursuant to committee rules. Without objection, the reading of the amendment is dispensed with, and the substitute will be considered as original text for the purposes of amendment. Ranking Member Boss, you are recognized for 5 minutes in support of your amendment in the nature of a substitute.
Thank you, Mr. Chairman. My bill would require VA to install on-site medical waste management systems at certain VA medical facilities. The amendment in the nature of a substitute makes some technical corrections requested by the VA to my underlying bill. On-site medical waste management systems are considered a best practice by the Centers for Disease Control and Prevention and the World Health Organization. But only a minority, about 20% to my understanding of the VA medical facilities, have invested in an on-site medical waste management system. Using them as more VA medical facilities would benefit VA and the environment as well as save taxpayer dollars. They also ensure that the VA medical facilities are cleaner, safer places for veterans to seek care for the VA staff and for the VA staff to work. I ask all of my colleagues to support my amendment in the nature of a substitute, and with that, Mr. Chairman, I yield back.
Thank you, Ranking Member Boss. H.R. 291, the VA Cost Savings Enhancement Act, will require the Secretary of Veterans Affairs to develop an analytical model to compare the costs of offsite versus regulated medical waste treatment. The VA will further be required to install on-site regulated medical waste treatment systems at VA facilities that would realize cost savings within a 5-year period. Regulated medical waste is any type of waste generated by healthcare facilities that may be contaminated by blood, bodily fluids, or other potentially infectious materials. There are federal and state requirements governing how it must be handled and how it may be transported, given the given the infection transmission risks it poses. On-site regulated medical waste sterilization systems would enable VA medical facilities to treat and compact this waste before it is transported off-site for disposal. There are potential cost savings associated with being able to sterilize and compact the medical waste before it is taken off-site. Trucking costs are higher for untreated medical waste because of all of the precautions that must be taken to comply with applicable state and federal regulations when transporting it, because it takes more trucks to move the waste if it is not compacted first. I urge my colleagues to join me in supporting this legislation. Is there further debate on the Bost Amendment? If not, the question is on the Bost Amendment in the nature of a substitute. All those in favor say aye. All those opposed say no. In the opinion of the chair, the ayes have it, and the amendment is agreed to, and without objection, the motion to reconsider is laid on the table. Is there further debate on H.R. 291? If not, I recognize Ranking Member Bost for a motion.
Mr. Chairman, I move the committee report H.R. 291 as amended favorably to the House floor.
All those in favor will say aye.
Aye.
Any opposed, say no. In the opinion of the chair, the ayes have it, and the motion is agreed to. Without objection, the motion to reconsider is laid on the table. Without objection, the staff is authorized to make necessary technical and conforming changes in the committee amendments.
Mr. Chairman.
Ranking Member Bost.
Mr. Chairman, pursuant to House Rules 11, Clause 2, I give notice of intent to file minority and supplemental additional or dissenting views on H.R. 291 as amended.
Without objection, is so ordered. I will point out that we are more than halfway through the list of 16 bills. We still need to vote on a few roll call votes, but we are more than halfway through the legislative agenda. We will now move to consider H.R. 5752. The clerk will designate the bill.
H.R. 5752.
Text was circulated in advance pursuant to committee rules. Without objection, the first reading is dispensed with. I recognize Chairman Levin for 5 minutes in support of his bill.
Mr. Chairman, thank you for including my bipartisan legislation, the Emergency Relief for Service Members Act, in today's markup. At the beginning of the COVID-19 pandemic, the Department of Defense issued a stop movement order which restricted travel, including permanent changes of station, or PCSs. This caught many military families in the middle of a PCS, having already entered into telephone, cable, or internet service contracts for their new home. While the Service Members Civil Relief Act provides service members with the right to terminate a telecommunications contract without penalty upon receiving military orders to relocate, it does not cover situations like these. As a result, military families suffered personal financial losses as they were forced to pay for services that they were ultimately not able to use through no fault of their own. Military families make incredible personal sacrifices moving from one base to another, particularly when sudden stop movement orders interrupt those plans. The last thing they should be stuck with is an extra cable, phone, or internet bill for a place where they don't even live. That's exactly the loophole that the Emergency Relief for Service Members Act will close. I'm also thrilled that the ANS incorporates other improvements to the Service Members Civil Relief Act. Specifically, it expands contract protections to spouses and dependents who accompany service members during relocation, and expands the definition of covered contracts to include gym memberships, fitness programs, and home security services. I urge my colleagues to support these common-sense changes to protect military families by voting in favor of the Emergency Relief for Service Members Act. Thank you, and I yield back.
Thank you, Chairman Levin. I now recognize Ranking Member Bost for an amendment.
I have an amendment of nature of substitute at the desk.
The clerk will designate the ANS.
Amendment in the nature of a substitute.
Text was circulated in advance pursuant to committee rules. Without objection, the reading of the amendment is dispensed with, and the substitute will be considered as original text for the purposes of amendment. Ranking Member Bost, you are recognized for 5 minutes in support of your amendment in the nature of a substitute.
Thank you, Mr. Chairman. My amendment keeps the base text, will also include text from H.R. 2650, the Military Spouse Licensing Relief Act, and the text of H.R. 4702, the Military Spouse Tax Act. H.R. 2650, introduced by Congressman Mike Garcia, would help ensure that the military spouses are able to transfer their state-based professional license when they move to another state due to a permanent change of station. This is an important change that will help reduce unemployment among the military spouses. H.R. 4702, introduced by Congressman Cawthorn, would help clarify the state that the military spouses can file taxes when their family is deployed to a new state. I thank Congressman Garcia and Cawthorn for their legislation, and thank Chairman Levin for allowing our side to attach them to the bill. With that, I yield back.
Well, thank you, Ranking Member Bost. Service members have long complained about being held to contracts for household needs like phone, internet, and gym memberships when they're required to relocate due to military orders. Similarly, COVID-19 resulted in many service members being given stop movement orders, leaving many bound to contracts that were not of use or outdated. Chairman Levin's Emergency Relief for Service Members Act solves these issues by allowing these service members to get out of contracts they were wrongly bound to because of their orders. So, families have suffered fines, excessive bills, damage to their credit scores, to circumstances completely out of their control. The ANS to H.R. 5752 further improves protections for service members and their families by adding the text of H.R. 2650, the Military Spouse Licensing Relief Act. The ANS provides service members and their spouses the ability to bring professional licenses with them when they are relocated because of military orders. I thank Chairman Levin for his work on this underlying legislation and Ranking Member Bost for his amendment, and I urge support. Does any other member wish to be recognized to discuss the amendment and nature of a substitute to H.R. 5752? If not, the question is now on the Bost amendment and nature of a substitute to H.R. 5752. All those in favor say aye. All those opposed say no. In the opinion of the chair, the ayes have it, and the Bost amendment and nature of a substitute is agreed to, and without objection, the motion to reconsider is laid on the table. Is there further debate on H.R. 5752? If not, I recognize Ranking Member Bost for a motion. Ranking Member Bost.
Mr. Chairman, I move that the committee report H.R. 5752 as amended favorably to the full House of Representatives.
All those in favor will say aye. All those opposed will say no. In the opinion of the chair, the ayes have it, and the motion is agreed to. Without objection, the motion to reconsider is laid on the table. Without objection, the staff is authorized to make necessary technical and conforming changes in the committee amendments. Ranking Member.
Thank you, Mr. Chairman. Pursuant to House Rule 11, Clause 2, I give notice to intent to file minority and supplemental additional and/or dissenting views on H.R. 5752 as amended.
Without objection, so ordered. I now call up H.R. 7939. The clerk will please designate the bill.
H.R. 7939.
The text was circulated in advance pursuant to committee rules. Without objection, the first reading is dispensed with. I now recognize Representative Levin to offer an amendment.
Mr. Chairman, I have an amendment in the nature of a substitute at the desk.
The clerk will designate the amendment in the nature of a substitute.
Amendment in the nature of a substitute.
Text was
H.R.
circulated in advance pursuant to committee rules. Without objection, the reading of the amendment is dispensed with, and the substitute will be considered as original text for the purposes of amendment. Mr. Levin, you are recognized for 5 minutes in support of your amendment in the nature of a substitute.
Mr. Chairman, thank you for including my bipartisan legislation, H.R. 7939, the Student Veteran Emergency Relief Act, in today's markup. The COVID-19 pandemic exposed flaws in student veteran benefits, nearly cutting housing benefits for hundreds of thousands of students nationwide. However, this committee acted swiftly during 2020, passing several crucial acts, including the Chairman's Student Veteran Coronavirus Response Act, into law. These actions meant students were protected from losing their benefits, but only for a limited time. While I'm thankful we never left students without their benefits, we came close far too many times. H.R. 7939 does away with these artificial benefit cliffs for student veterans and makes permanent many of the student veteran protections passed as short-term measures in 2020 and 2021. That means the next time there's an emergency, be it nationwide or local, VA will be able to fully pay out benefits to students who are forced to attend classes remotely. It could be any one of our communities devastated by a flood, tornado, or any other emergency, forcing students to take their classes online for a period of time. That's why I introduced the Student Veteran Emergency Relief Act, which provides this benefit backstop. This legislation is supported by disabled American veterans, Veterans Education Success, Student Veterans of America, Veterans of Foreign Wars, and VA. The amendment in the nature of a substitute builds upon the protections of H.R. 7939 and includes legislation by Ranking Member Bost and Chair Takano to simplify reporting for colleges and universities under VA's 8515 rule. The ANS also modernizes VA program approval standards and fixes VA study abroad approvals so international students can receive a GI Bill education without worrying about their benefits. Finally, the ANS includes additional legislation from the Ranking Member and Representative Slotkin to provide eligibility for educational benefits for individuals who receive sole survivorship discharges. I urge my colleagues to support the amendment in the nature of a substitute and the underlying legislation, and I yield back.
Does any other member wish to be recognized to discuss the amendment in nature of a substitute to H.R. 7939? Ranking Member Bost.
Thank you, Mr. Chairman. I support the amendment in the nature of a substitute to H.R. 7939. This is a bipartisan bill led by Chairman Levin and Ranking Member Moore of the Subcommittee on Economic Opportunity. The amendment in the nature of substitute will keep the text of the base bill to provide emergency protection for student veterans if a pandemic like COVID-19 hits our country again. Pray it does not. I was proud to work on our emergency extensions of the authority with the chairman and late last year. I am also pleased that these protections are also fully offset by extended current home loan funding fees in FY 2032. I want to thank Mr. Levin, or Chairman Levin, for including the text of many proposals from our side of the aisle, including the text of my bill, H.R. 8198, that would streamline the way that the VA interprets the 8515 rule. And this will help reduce the administrative burden on schools who provide GI Bill benefits. I was proud to work with Chairman Takano and our colleagues in the Senate, Chairman Tester and Ranking Member Moran, to introduce this bill. I also want to commend Congressman Rosendale and Dr. Miller Meeks for continuing to raise this issue and work with us on a comprehensive solution. I'm also happy that the text of the amendment in the nature of a substitute includes Congressman Joyce's bill and would extend full post-9/11 GI Bill benefits to service members who have been discharged under DOD's sole survivor rules. This issue directly impacts Representative Joyce's constituent and the Weinier family, and I am pleased that the Representative Joyce and Tragic Assistance Program for Survivors brought this issue to our attention. It also includes the text of Congressman Moore's bill that will improve the way that schools are approved for GI Bill to help prevent waste, fraud, and abuse. Finally, the amendment in the nature of a substitute includes GOP proposal that would help improve access to study abroad programs while using the GI Bill. I thank the gentleman for his work on this amendment, and it has my full support. And with that, Mr. Chairman, I yield back.
Thank you, Ranking Member Bost. Does any other member wish to be recognized to discuss the amendment in the nature of a substitute to H.R. 7939?
Mr. Chair.
Ranking Member Rosendale.
Thank you very much, Mr. Chair. I find that the necessity for this bill is born, unfortunately, out of poor governance. Many of the provisions of this bill are direct responses to the combination of government-mandated lockdowns and the administrative bottleneck of the VA regulatory body. Because of this, many veterans and many of the programs educating our veterans have spent the last 2 years trying to figure out what's going on to happen from them from one term to the next. And when it comes to Congress' role in all this, we're often trying to solve local issues or edge cases by coming up with an all-encompassing rule that seems so simple and elegant from here in Washington, but creates all kinds of havoc to the bureaucrats in the administration try and figure out what our laws actually mean for the colleges and universities. As a case in point, the 85-15 rule states that in a given program, only 15% of students may be receiving tuition assistance. It's supposed to be that way to combat fraud and predatory institutions that target veteran with GI Bill dollars. But what it became was a labor and paperwork burden for colleges and universities that had to keep track of which students met what criteria for a covered student, the definition of which continuously changed under the VA. We have had numerous complaints from the schools in Montana at every term, worried that the new rules were going to arbitrarily exclude all of their student veterans. Furthermore, each one, when asked individually, complained that they were spending hours and hours of time on paperwork for every veteran that they had enrolled, and oftentimes without any VA follow-up. I personally worked with a veteran who moved across the country with his new wife to begin education, only to be told after starting that he was ineligible. I'm pleased that this bill includes language of a bill I've been working on. It will tighten the definition of what the 15 means and what the 85 actually means. These shifting definitions have made providing education to veterans an enormous headache for the schools. When we guarantee our veterans have tuition benefits, we also need to guarantee that there will be institutions who are willing to deliver on that. This part of the bill will go a long way towards that end. Thank you very much, Mr. Chair, and I yield back.
Thank you, Mr. Rosendale. Any other members wish to be recognized to discuss the amendment in nature of substitute to H.R. 7939? If not, the question is now on the 11 amendment in the nature of substitute to H.R. 7939. All those in favor will say aye. Aye. All those opposed will say no. In the opinion of the chair, the ayes have it, and the 11 amendment in the nature of a substitute is agreed to. Without objection, the motion to reconsider is laid on the table. Is there further debate on H.R. 7939? If not, I recognize Ranking Member Boss for a motion.
Mr. Chairman, I move that the committee report H.R. 7939 as amended favorably to the full House of Representatives.
All those in favor will say aye.
Aye.
All those opposed will say no. In the opinion of the chair, the ayes have it, and the motion is agreed to. Without objection, the motion to reconsider is laid on the table. Without objection, the staff is authorized to make necessary technical and conforming changes in the committee amendments.
Mr. Chairman,
Member Bost.
Mr. Chairman, for purposes pursuant to House Rule 11, Clause 2, I give notice to intent to file minority or supplemental additional and dissenting views on H.R. 7939 as amended.
What objections so ordered? I understand that Representative Nels is having some technical difficulties. We will, as soon as he gets back on, as soon as we finish with the business at hand, we'll get to his bill. So as Mr. Nels attempts to get back on.
He's on.
Is he on now? Oh, he's coming on now. Okay.
Yes, I'm here. I'm sorry. Juggling between these meetings, these hearings.
We've all had our encounters with technology purgatories. So I now call up H.R. 7188. The clerk will please designate the bill.
H.R. 7188.
Text was circulated in advance pursuant to committee rules without objection. The first reading of the bill, is dispensed with, and I now recognize Representative Nels to offer an amendment.
Yeah.
Mr. Nels, do you have an amendment to offer?
Yes, sir. Thank you, Mr. Chair. My amendment in the nature of a substitute would invest in the modernization.
Mr. Nels, just hang on. You have an amendment at the desk?
Yes, I do. I have an amendment in the nature of a substitute at the desk. Yes, sir.
Thank you. The clerk will designate the amendment in the nature of a substitute.
Amendment in the nature of a substitute to H.R.
The text was
71.
circulated in advance pursuant to committee rules. Without objection, the reading of the reading of the amendment is dispensed with, and the substitute will be considered as original text for the purposes of amendment. Mr. Nels, you are recognized for 5 minutes in support of your amendment in the nature of a substitute.
Thank you, Mr. Chairman. My amendment in the nature of a substitute would invest in the modernization of VBA's information technology systems. VBA's disability claims process is inefficient and outdated, and I applaud VA for taking steps to increase efficiency by piloting the use of automation to process certain claims and order disability exams. I've been closely monitoring the pilot to ensure the VA's not further leverage technology to improve the delivery of these benefits, VA will continue to face high claims backlogs. VA's investment in IT is critical given the VA expects the claims backlog to rise by hundreds of thousands, if not millions, after the PACT Act was enacted. I believe VA could mitigate the effects of a future backlog through technology. That is why I introduced the underlying bill to my amendment, H.R. 7188, the modernizing of the VA Disability Benefits Questionnaires, which is DBQ Act. This provision would help facilitate the expansion of automation by making the information in DBQs more effective. Currently, VA does not require contract disability examiners to provide DBQs in a format that is easily read by VA's claims automation software. And as a result, automation is more error prone or not possible depending on the quality of the DBQ. This bill would require VA to create a universal standard that contractors must use when submitting DBQs to make them more useful and accurate. This sets the foundation for VA to expand automation in the claims process and, as a result, reduce wait times for veterans. Additionally, my amendment would require VA to provide a plan for an online portal that would make it easier for a veteran's private physician to submit a DBQ in support of the veteran's claim. I believe such a portal could reduce the need for a veteran to report a VHA or contract disability examiner by providing VA with all the medical evidence needed to render a decision. This would help make the claims process more convenient for veterans who may find it easier to attend an exam completed by their local physician rather than by an exam provided by VA. Moreover, my amendment adds to the text of Congressman Rosendale's bill, H.R. 7256, the Expediting Temporary Ratings for Veterans Act. Often, VA inconsistently processes claims for a temporary 100% rating due to hospitalization for a service-connected condition. Some veterans may receive a decision in a matter of days, while other veterans may wait months. Congressman Rosendale's bill would require VA to use automation to process these claims if VA already has the information it needs to develop it. However, an employee would still render the final decision. By using technology to develop these claims, employees can focus on providing veterans with quality services, not menial tasks. And I thank Congressman Rosendale for his participation on this issue, and I ask all my colleagues to support my amendment. And thank you. I yield back.
Well, thank you, Representative Nels. This amendment in nature of a substitute requires VA to make modifications to allow all disability benefit questionnaire data collected in the course of a non-VA employee be a performed disability evaluation to be transmitted to the VA in a machine-readable format within 180 days after enactment. It will also add the text of Mr. Rosendale's H.R. 7256, the Expediting Temporary Ratings for Veterans Act, which would require VA to modify its information technology systems to provide for the automatic processing of claims for temporary disability ratings for veterans who have a service-connected disability that requires hospital treatment or observation for a period in excess of 21 days. A disability benefit questionnaire, or DBQ, is a medical evaluation form utilized by the Veterans Benefit Administration's Compensation Service to assist in adjudicating claims for disability compensation. When necessary, VBA requires in-house or contract compensation and pension medical examiners to complete these forms following their evaluation of a veteran's contended service connected condition. Now, these evaluations are then included in the overall evidence of record that a compensation service rating specialist considers when deciding a claim and assigning a rating percentage. In other words, a DBQ is often a critical component of service connection determination, of the service connection determination process. A successful determination depends heavily on information. With the receipt of more information, the better the probability for a grant of service connection and the obtainment of supportive disability benefits. The submission of a non-VA employee DBQ is a welcome addition to the evidence of record when deciding a claim. And the faster this information can make it into the record, the better the assurance that it will be seen and considered at adjudication. Now, enhancing VBA's ability to expedite temporary rating decisions is just as important. Veterans in need of additional temporary assistance due to unforeseen hospitalization or observation often do not have the luxury of time to wait for administrative delays linked to such straightforward requests for support. This legislation will greatly assist in seeing that VBA develops the IT infrastructure required for rapid transmission of DBQs into electronic claims files and making of timely decisions for those veterans in need of temporary yet critical support. I fully support this ANS to H.R. 7188, and I urge my colleagues to do the same. Does any other member wish to be recognized to discuss the amendment in nature of substitute to H.R. 7188? Ranking Member Bost.
Thank you, Mr. Chairman. The amendment in the nature of substitute H.R. 7188 would help modernize the disability claims process. I appreciate Ranking Member Niels for introducing the underlying bill. And first, the bill would require contract disability examiners to submit disability benefits questionnaires or DBQs in a form that is easily read by VA's claim automation software. DBQ provides the medical evidence that raters need to decide the claim, and if warranted, to determine whether the veteran's disability rating is. This bill would make the information, the DBQs, more useful and help facilitate VA's efforts to use advanced technology to develop claims. It would also require VA to provide a claim for covenant online portal that a veterans provides physicians can use to submit a DBQ that is compatible with the modern technology. This portal would provide veterans with the most effective option to submit medical evidence in support of their claim. The amendment also includes a text of H.R. 7256, which was introduced by TM Ranking Member Rosendale. His provision would help veterans who are hospitalized for more than 21 days due to a service-connected condition receive a temporary 100% rating faster. VA provides a temporary 100% rating for a veteran who cannot work while they are receiving inpatient care for service-connected disabilities. Sick veterans should not have to face delays in receiving the benefits that they have earned due to VA outdated claims process. I fully support this amendment, and with that, I yield back.
Thank you, Ranking Member Bost. Does any other member wish to be recognized to discuss the amendment in nature of substitute to H.R. 7188?
Mr. Chair.
Mr. Rosendale, you're recognized for 5 minutes.
Thank you very much, Mr. Chair. I appreciate the opportunity to discuss my legislation, H.R. 7256, the Expediting Temporary Ratings for Veterans Act, which is included in the ANS. This bill would directly help some of the sickest veterans who depend most on VA disability compensation benefits. When a veteran is hospitalized for at least 21 days for a service-connected condition or illness, current law grants them a temporary increase in their disability rating up to 100%. The problem is, those rating increases may not be granted before the veteran leaves the hospital, or granted in the right amount, or granted at all. The OIG found that nearly half of eligible veterans had their benefits adjusted incorrectly or their claims improperly processed. When a VA makes a mistake and overpays the veteran, that overpayment is sometimes collected as a debt. That's unacceptable. The VA should not be hassling ailing veterans from its own errors. My legislation directs the VA to use the medical records information it already has to determine who is hospitalized and automate many of these rating increases. The VA has been conducting a limited pilot program, and my bill would expand it within 1 year to speed up claims processing for veterans hospitalized with all illnesses or conditions. There will still be some situations where the medical records are insufficient or the case is too complicated to automate, but overall, the claims process is one of the best candidates for automation. That said, VA employees will continue to make every final eligibility determination. They will always decide whether to accept or reject what the automation software proposes. I think this is an idea whose time has come. We can use IT to make veterans' benefits more timely, more accurate, and more consistent. I want to thank Chairwoman Loria and Ranking Member Nels for working with me to advance this bill. Thank you very much, Mr. Chair, and I yield back.
Thank you, Ranking Member Rosendale. Are there any other members of the committee who wish to be recognized to discuss the amendment in nature of substitute to H.R. 7188? If not, the question is now on the Nels amendment in the nature of the substitute to H.R. 7188. All those in favor will say aye.
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 Those opposed will say no. In the opinion of the chair, the ayes have it, and the Nels amendment in nature of substitute is agreed to. Without objection, the motion to reconsider is laid on the table. Is there further debate on H.R. 7188? If not, I'm going to recognize Ranking Member Boss for a motion.
Mr. Chairman, I move that the committee report H.R. 7188 as amended favorably to the full House of Representatives.
All those in favor will say aye. Aye. Any opposed will say no. In the opinion of the chair, the ayes have it, and the motion is agreed to. Without objection, the motion to reconsider is laid on the table. Without objection, the staff is authorized to make necessary technical and conforming changes in the committee amendments.
Mr. Chairman.
Ranking Member Bost.
Mr. Chairman, pursuant to House Rule 11, Clause 2, I give notice of intent to file minority and or supplemental additional or dissenting views on H.R. 7188 as amended.
Without objection, so ordered. We will now consider H.R. 7735. The clerk will designate the bill.
H.R. 7735.
Text was circulated in advance pursuant to committee rules. Without objection, the reading of the amendment is dispensed with. I now recognize Ranking Member Boss to offer an amendment.
Mr. Chairman, I have amendment in the nature of substitute at the desk.
The clerk will designate the amendment in the nature of a substitute.
Amendment in the nature of a
Text was
substitute.
also circulated in advance pursuant to committee rules. Without objection, the first reading is dispensed with and is considered as read and will be considered as original text for the purposes of amendment. I now recognize Ranking Member Boss for 5 minutes in support of his amendment.
Thank you, Mr. Chairman. My amendment in the nature of substitute would update and improve appraisal requirements for veterans' home loans to be in line with today's industry standards. This will make the process for a veteran to purchase a home loan more efficient by shortening the appraisal time. It was also require VA to consider when changes to the appraisal process would save a veteran money during the closing process. Finally, it would force VA to consider embracing new technologies by requiring increased use of desktop appraisals. I want to thank the mortgage bankers and the stakeholders for their work to help make the VA loan product more competitive. I ask my colleagues to support my amendment in the nature of a substitute, and with that, Mr. Chairman, I yield back.
Thank you, Ranking Member Boss. I want to, we both agree that veterans should be able to use their earned income, not their earned income, but their earned home loan benefit in a competitive way with conventional and cash buyers. And that is why H.R. 7735 directs VA to make needed improvements to the appraisal portion of the program where some veterans have experienced delays. The nature of a substitute adds the amendment in the nature of substitute adds some additional goalposts for these improvements by first having VA conduct an internal review of the program, share those findings with Congress, and then implement necessary changes in line with the findings shared with Congress. So I want to thank Ranking Member Boss and his staff for working with me and my staff on this bill, and I urge support of the amendment in nature of substitute to H.R. 7735. So does any other member wish to be recognized to discuss the amendment in nature of substitute to H.R. 7735? If not, the question is now on the Bost amendment in nature of substitute to H.R. 7735. All those in favor say aye. All those opposed say no. In the opinion of the chair, the ayes have it, and the Bost amendment in the nature of substitute is agreed to. Without objection, the motion to reconsider is laid on the table. Is there further debate on H.R. 7735? If not, I recognize Ranking Member Boss for a motion.
Thank you, Mr. Chairman. I move the committee report H.R. 7735 as amended favorably to the full House of Representatives.
All those in favor say aye. Opposed, say no. In the opinion of the chair, the ayes have it. The motion is agreed to. Without objection, the motion to reconsider is laid on the table. Without objection, the staff is authorized to make necessary technical and conforming changes in the committee amendments.
Mr. Chairman,
Ranking Member Boss.
pursuant to House Rule 11, Clause 2, I give notice of intent to file minority or supplemental, additional, or dissenting views on H.R. 7735 as amended.
Without objection, so ordered. I believe we're on the final three bills. Okay, we're in the final stretch. All right, we will now consider H.R. 8313. The clerk would designate the bill.
H.R. 8313.
Text was
to amend-
circulated in advance pursuant to committee rules. Without objection, the First Amendment is dispensed with. H.R. 8313 was introduced by Representative O'Halloran. This bill would make critical changes to broaden the pool of veterans who may receive assistance through HUD-VASH. H.R. 8313 gets us one step closer to ending veteran homelessness, and I thank Representative O'Halloran for his hard work. I now recognize Representative Trone to offer an amendment. Representative Trone?
Thank you, Chairman Takano and Ranking Member Boss, for holding this.
Representative Trone, just one thing. Do you have an amendment in the nature of a substitute to H.R. 8313 at the desk?
Yes, I do.
The clerk will designate the amendment.
Amendment in the nature of a substitute.
The text was circulated in advance pursuant to committee rules. Without objection, the reading of the amendment is dispensed with, and the substitute will be considered as original text for the purposes of amendment. Representative Trone, you are recognized for 5 minutes in support of your amendment in the nature of a substitute.
Excellent. Thank you, Chairman Takano and Ranking Member Boss, for holding this important markup that will help advance 18 pieces of legislation to help our vets across the country. Today, I'm offering the ANS to H.R. 8313. I want to underscore the significance of this ANS and the other homelessness bills that we're considering today. HUD-VASH has grown from a program that began with 10,000 vouchers nationally to now over 100,000 vouchers. The number of vets under lease with HUD-VASH vouchers has been stuck at 80,000 for the past several years, even as Congress continues to add new vouchers to the program, even as the annual point-in-time count indicates that nearly 40,000 vets remain homeless on any given night. 40,000. Among these veterans, nearly a third report zero income in the 30 days prior to engagement by the VA. But half of them also report no substance abuse, and 40% report no concerns of mental health. So taken together, this data demonstrates there are many homeless vets who absolutely lack the financial ability to attain permanent housing, zero income, but who do not demonstrate a significant need for case management based on the data on substance use and mental health concerns. The House Every Veteran Act does just as its name says. It ensures that vets who have fallen into hard times and may not meet the traditional requirements of HUD-VASH can access permanent housing while also preserving the central intent of the program by continuing to focus the resources on those that are chronically homeless. This A&S prevents homelessness on the front end through investment in the SSVF, shallow subsidy, and rapid resolution initiatives that keeps the vets' families together and stably housed when times get tough. And it gets more people experiencing homelessness into permanent supportive housing by expanding the ability of HUD-VASH and the healthcare of homeless veterans program. I truly hope my colleagues will recognize the significance of this legislation in pursuit of our shared goal, end veteran homelessness. I urge our colleagues to vote yes on this amendment in the nature of a substitute, HR 8313. On the additional amendment,
Mr. Crone, I understand you have an amendment in the nature, amendment to the amendment in the nature of a substitute to HR 813 at the desk.
Yes, I do.
So the clerk will designate the amendment to the amendment in the nature of a substitute.
Amendment to the amendment in the nature of a substitute.
The text is
HR
circulated in advance pursuant to committee rules without objection. The reading of the amendment is dispensed with. Mr. Trone, you're recognized for 5 minutes in support of your amendment.
Thank you, Mr. Chairman. On the additional amendment, it simply strikes Section 3 from the underlying ANS. And we look forward to working with the House Financial Services Committee to refine and perfect the language contained in Section 3 to ensure the homeless veterans face no barriers during their journey into permanent housing through HUD-VASH program. Thank you, Mr. Chairman. I yield back.
Well, thank you, Mr. Trone. This legislation makes critical changes to the HUD-VASH program, which is one of the most effective federal tools to permanently house homeless veterans. This ANS will increase HUD-VASH voucher utilization and get more veterans experiencing homelessness into permanent housing by expanding eligibility for the subsidy, helping us in our present pursuit to house every veteran and finally end veteran homelessness. I look forward to working with my friend Chairwoman Waters and her staff on the Financial Services Committee to continue to improve the HUD-VASH program. The ANS also makes important changes and investments in programs that prevent veteran homelessness by increasing funding for the Supportive Services for Homeless Veterans program and expanding eligibility for the Health Care for Homeless Veterans program. The amendment to the ANS removes Section 3 of the legislation, which lies predominantly within the jurisdiction of the Financial Services Committee. And I plan to work with Chairwoman Waters to address these provisions with her committee, VSOs, and homelessness advocates. But I agree with Representative Trone's amendment to remove this section now so we can continue to work on it. And I thank Representative Trone for offering this amendment, and I urge my colleagues to support the amendment to the amendment in the nature of the substitute to H.R. 8313. Is there further debate on the Trone amendment to the ANS?
Mr. Chairman.
Ranking Member Boss.
Thank you, Mr. Chairman. Unfortunately, I'm unable to support the amendment in the nature of a substitute. I wanted to thank the chairman and Congressman Levin for working on homeless veterans issues, but I believe that there are too many unanswered questions to support the bill.
I understand that.
I'm supportive of the changes to the health care for the homeless veterans program, along with the reauthorization of the Advisory Committee on Homeless Veterans that are proposed in the bill. However, I do have concerns with the proposed changes to the HUD-VASH program. The bill would fundamentally change the requirement of the HUD-VASH program to provide vouchers to homeless veterans that are not in need of wraparound clinical services. Understanding that the goal for the amendment in the nature of the substitute is to better utilize HUD-VASH vouchers that have been funded but are not being used due to a variety of factors, including a lack of VA's caseworkers. However, I believe that this change has an unintended consequence of altering the entire nature of the program. The HUD-VASH voucher is meant to be used for those veterans who need this type of service to be provided by a dedicated caseworker. That is what the this program from, distinguishes this program from the federal housing voucher programs. It is unfortunate that thousands of HUD vouchers are not being used, but the solution is not to change the eligibility standards for the program. Instead, we should continue to hold VA's feet to the fire. Just last week, we learned that VA is using the new authorities that Leader McCarthy and Chairman Levin championed in the Isaac Rowe law to contract out for services when there are not enough VA caseworkers on hand. The number of caseworker vacancies has dropped from 641 2 years ago to now just 16. We need to give these counselors the time that they need to work with veterans who need wraparound services and get them housed. We also do not have formal views on the languages for the VA household or the cost estimate for this proposal. I would remind the chairman that our committee rules require cost estimates before a legislative proposal is put to the vote. Finally, I'm also concerned about the rise in funding proposal in the bill for the SSVS program that expands VA shallow subsidy program. This is a pilot program that helps prevent homelessness by providing rental assistance. While I'm very supportive of the preventive programs, we should wait on the results of the pilot before spending millions on new funding. I want to continue to work with the gentleman on the text, and I would hope that we can receive answers to the questions that I've raised today before we take the bill to the floor. While the bill could help improve outcomes for this population of veterans, I believe that there is a better solution, and I reluctantly urge our members to oppose this part of the amendment in the nature of a substitute. And I am supportive of the amendment that would the provisions of underlying amendment that in the nature of a substitute that are outside the jurisdictions of the committee. If this amendment is adopted, I will still oppose the underlying amendment in the nature of a substitute for that reason, for the reason I've just laid out. With that, I yield back.
Thank you, Ranking Member Bost. My question is there further debate on the Trone amendment to the amendment in the nature of a substitute? And I have a number of members who are going to be recognized, but I'm assuming these members want to be recognized to speak on the ANS itself. So does anybody wish to speak on the amendment to the amendment on the the amendment to the amendment of the nature of the amendment in the nature of a substitute? If not, the question is on the Trone amendment to the amendment in the nature of a substitute to H.R. 8313. All those in favor will say aye. Aye. Any opposed will say no. No. In the opinion of the chair, the ayes have it, and the Trone amendment to the amendment in the nature of a substitute is agreed to. And without objection, the motion to reconsider is laid on the table. Now, I now invite members who wish to be recognized to discuss the amendment to amendment in the nature of a substitute to H.R. 8313. I see that Chairman Levin, you're recognized, Chairman Levin, for 5 minutes.
Mr. Chairman, thank you for including the House Every Veteran Act in today's markup. I was proud to introduce this legislation with Representative O'Halloran to expand the HUD-VASH program by filling gaps in eligibility. The men and women who served our country should never be without a roof over their heads. But current law limits the HUD-VASH program only to homeless veterans who have chronic mental illness or chronic substance use disorders. Without one of those diagnoses, a veteran may not use one of the thousands of HUD-VASH vouchers currently available. While it's crucial that the HUD-VASH program prioritize the most vulnerable homeless veterans, it's absurd to prevent other struggling veterans from accessing extra vouchers that would otherwise go unused. With the amendments we're considering today, the House Every Veteran Act will make the necessary changes to Veterans Benefits Law to expand HUD-VASH eligibility to more homeless veterans, regardless of whether they need case management. I look forward to working with the House Financial Services Committee to make corresponding changes in housing law that will unlock these resources. As chair of the House Veterans Affairs Committee Economic Opportunities Subcommittee, I'm committed to ensuring that homeless veterans and their families receive the resources and services they deserve, and I hope my colleagues will join me in this effort. I urge my colleagues to support the amendment in the nature of a substitute and the underlying legislation, and I yield back.
Thank you, Mr. Levin. Are there any other members who wish to be recognized to speak on the amendment in the nature of substitute to H.R. 8313? I have also here Mr. Pappas. Mr. Pappas, you're recognized for 5 minutes.
Thank you very much, Mr. Chairman, and I'm pleased to be able to speak in support of this ANS, which includes my bill, H.R. 7753, the Preventing Homelessness for Veterans Families Act. Now, this particular bill reauthorizes and increases funding for the VA Supportive Services for Veterans Families, or SSVF program. These grants are awarded to organizations that assist very low-income veteran families residing in or transitioning to permanent housing. These grants provide a range of supportive services to veteran families that are designed to promote housing stability. Now, in 2019, the VA built on the success of SSVF and introduced the Shallow Subsidy Initiative. Shallow Subsidy was targeted to veterans residing in areas with a high cost of living and provided up to 35% of their rent. Now, notably, the shallow subsidy amount doesn't change regardless of increases or decreases in the veteran's household income or rent during the 2-year period. Last year, VA expanded the program nationwide and increased the subsidy to a maximum of 50%. So my bill's simple. It supports the expansion of increasing the authorized funding for SSVF to reflect the cost of the shallow subsidy initiative while also ensuring that other critical facets of SSVF are also funded. This program has aided thousands of low-income veterans and their families, has helped them find permanent housing for their own, and SSVF is one of the most effective tools that VA has to prevent at-risk veterans from experiencing homelessness. So as we strive to get to zero homeless veterans, this is an important tool, and I'm glad that this is included in the ANS. I urge support for it, as well as the underlying bill, and I yield back the balance of my time.
Thank you, Representative Pappas. Is there any other member who wishes to be recognized to speak on the Trone ANS to H.R. 8313? I have Dr. Ruiz. Dr. Ruiz, you're recognized for 5 minutes.
Yes, I have an amendment in the nature of the substitute.
Which does?
Are we at that point yet?
We still are on the amendment.
Okay.
Dr. Ruiz, I don't think we don't have an amendment filed for you for this particular, for 8313. Are you sure your amendment, your ANS is for 8313?
No, it's okay. Thank you.
Okay, no, thank you, Dr. Ruiz. Is there any other member who wishes to speak on H.R. 8313, the ANS? If not, the question is now on the Trone amendment in nature of substitute to H.R. 8313. All those in favor will say aye. Aye. All those opposed will say no. No. In the opinion of the chair, the ayes have it, and the Trone amendment in nature of substitute is agreed to. Without objection, the motion to reconsider is laid on the table. Is there further discussion on H.R. 8313? If not, I recognize Representative Brownlee for a motion.
Mr. Chairman, I move that H.R. 8313 be reported favorably to the House.
All those in favor will say aye. All those opposed will say no. No. In the opinion of the chair, the ayes have it. Suggests the absence of a quorum. Well, okay. Any members who are on the platform?
We have Ms. Mason just walked in the room.
Okay, all right. So, did I call for a vote? In the opinion of the chair, the ayes have it, and the motion is agreed to. Without objection, the motion to reconsider is laid on the table. Without objection, the staff is authorized to make necessary technical and conforming changes in the committee amendments. Ranking Member Boss.
Mr. Chairman, pursuant to House Rule 11, Clause 2, I give notice of intent to file minority or supplemental additional and dissenting views on H.R. 8313 as amended.
Without objection, so ordered. We will now consider H.R. 5916. The clerk will designate the bill.
H.R. 5916.
Text was circulated in advance without and without objection, the first reading is dispensed with, and I recognize myself to offer an amendment in the nature of a substitute. The clerk will designate the amendment in the nature of a substitute.
Amendment in the nature of a substitute to
The
H.R.
text was circulated in
59.
advance pursuant to committee rules. Without objection, the first reading is dispensed with and is considered as read and will be considered as the original text for the purposes of amendment. Without objection, a statement from Representative Aguilar, the bill's original sponsor, and associated letters in support of the bill will be included in the record. I now recognize myself for 5 minutes to speak on my amendment in the nature of a substitute. Now, Representative Aguilar's Wounded Warrior Access Act would require VA to establish and maintain a secure internet-based website to enable a claimant or their representative to make records requests related to VA claims and benefits. The website must allow the requester to specify the desired format for the record. VA must notify a requester within 10 days that the request has been received and must fulfill the request within 120 business days. My amendment makes some technical changes to the bill after we receive feedback from VA. Additionally, my ANS would add a provision requiring VA to warn claimants about benefit scammers, provide a way to report potentially fraudulent activity, and provide a tool for claimants to search for accredited representation. Currently, to make records requests related to VA claims and benefits, veterans or designated representatives must submit a Freedom of Information or FOIA or Privacy Act request. Submitting this form, awaiting its upload into an individual's electronic claims file, and awaiting action on the request can be time-consuming and negatively impact the claimant's ability to understand what records VA is evaluating and what information could better assist in a claim's positive adjudication. VA establishing and maintaining a secure internet-based website to enable a claimant and their representatives to make records requests related to VA claims and benefits would modernize this essential process and assist in more timely, positive claim outcomes. I urge my colleagues to support my amendment and the underlying legislation. Does any other member wish to be recognized to discuss
Mr. Chairman.
Ranking Member Bost?
Thank you, Mr. Chairman. The amendment in the nature of substitute on H.R. 5916 would require VA to establish a secure, public-facing website that veterans can use to request a copy of their VA records. This would make it easier for veterans to review the records before they file a claim or an appeal. I support efforts to make the VA more accessible for veterans by modernizing its systems. This proposal would also require VA to warn veterans about predatory claims practices when they log into the VA website. I have heard increasing concerns from veterans about bad actors attempting to defraud them of their veterans' benefits. This is despicable. I hope that these warnings will better ensure that the veterans are not being taken advantage of by these bad actors. And with that, Mr. Chairman, I yield back.
Thank you, Ranking Member Bost. Does any other member wish to be recognized to discuss the ANS to HR 5916? If not, the question is now on my amendment to my ANS to HR 5916. All those in favor will say aye.
Aye.
Any opposed will say no. In the opinion of the chair, the ayes have it, and the Takano amendment in the nature of a substitute is agreed to. Without objection, the motion to reconsider is laid on the table. Is there further debate on HR 5916? If not, I recognize Ranking Member Bost for a motion.
Mr. Chairman, I move that the committee report H.R. 5916 as amended favorably to the full House of Representatives.
All those in favor will say aye.
Aye.
All those opposed will say no. In the opinion of the chair, the ayes have it, and the motion is agreed to. Without objection, the motion to reconsider is laid on the table. Without objection, the staff is authorized to make necessary technical and conforming changes in the committee amendments. Ranking Member Bost.
Mr. Chairman, pursuant to House Rule 11, Clause 2, I give notice of intent to file minority or supplemental, additional, or dissenting views on H.R. 5916 as amended.
Without objection, so ordered. I call up now H.R. 6671. The clerk will designate the bill.
H.R. 6671.
Text was circulated in advance pursuant to committee rules. Without objection, the first reading is dispensed with. I recognize Ranking Member Bost to offer an amendment.
Thank you, Mr. Chairman. My amendment in the nature of substitute would keep the base text of
Ranking Member Boss, do you have an amendment?
I have an amendment at the desk, I'm sorry.
The clerk will designate the ANS.
Amendment in the nature of a substitute.
Text
to
will
HR
circulate in advance pursuant to committee rules. Without objection, the reading of the amendment is dispensed with and will be considered as original text for the purposes of amendment. Ranking Member Boss, you're recognized for 5 minutes.
Thank you,
in support
Mr.
of your
Chairman.
amendment in nature of substitute.
Mr. Chairman, my amendment in the nature of substitute would keep the base text of Congressman Fitzgerald's bill. His bill would ensure service members who are discharged with general discharges under honorable conditions as a result of their personal health care decision to not take the COVID vaccine are not denied the education benefits that they rightfully earned following their service in uniform. My amendment in the nature of a substitute would cover the cost of this bill by extending current home loan funding for a few months into 2031. This is a bipartisan, non-controversial offset that has been used many times by this committee. Mr. Chairman, I know that we and our colleagues continue to have significant disagreements about the need for vaccine mandates in this country. However, I hope that we can look at this issue today with a new lens that focuses on the impact that these decisions have on service members' futures. Earlier this month, the Army announced that because of mandates, 60,000 members of the National Guard and Reserve are ineligible for deployment and some federal benefits because they have made a decision not to receive the vaccine. Under current law, if a service member is discharged with anything less than an honorable discharge, they are ineligible for a post-9/11 GI Bill. This means that many service members who are discharged for declining the COVID vaccine due to medical or religious reasons and receive a general discharge under honorable conditions are impacted. I personally believe we should not punish these service members by denying them their hard-earned VA education benefits due to a personal health or faith-based decision. As I said, I know this discussion over the vaccine mandates is sensitive. However, I hope we can put this aside for those disagreements and ensure that these service members get the education they've earned. I ask for my colleagues to support the amendment in the nature of a substitute, and with that, Mr. Chairman, I yield back.
Well, thank you, Ranking Member Bost. I now recognize myself to offer an amendment to the amendment in the nature of a substitute. The clerk will designate the amendment to the amendment in the nature of a substitute.
Amendment to the amendment in the nature of a substitute.
Text will
HR
circulate in advance pursuant to committee rules. Without objection, the reading of the amendment is dispensed with, and I will now recognize myself for 5 minutes to speak on my amendment to the amendment in the nature of a substitute. Now, the legislation before us would grant those who refuse a vaccine and therefore granted a general discharge under honorable conditions access to veteran education benefits. According to the author of the legislation, if you are good enough to qualify for VA home loan benefits, VA health care, and VA pension benefits, you should also get your GI Bill benefit. It's an argument that I believe is worth considering. And that is why the amendment I'm filing amends the legislation to grant veteran education benefits to all veterans discharged under a general discharge under honorable conditions. This means tens of thousands of veterans who left the service due to mental illness. Cutting these veterans off from education only serves to isolate them further. It also means making amends to the tens of thousands of veterans forced out of the military during Don't Ask, Don't Tell, or due to their sexual orientation. If the author of this legislation thinks it's time to reconsider discharges and their impact on veterans' education, I welcome that discussion. However, I think it is better if we address this issue equitably. Further, I don't believe we should prioritize those who have refused a vaccine ahead of those who were forced to leave the military for their sexual orientation or because of mental health or other personal reasons. When the Economic Opportunity Subcommittee held a legislative hearing on this bill earlier this year, this is the same position taken by the VSO community. Those with a general discharge should not be left out in the cold, and we shouldn't be allowing those who refuse vaccines to jump ahead of the line. I urge my colleagues to support my amendment and finally fix all general discharges for education benefits. It is the right and fair thing to do. Now, is there further debate on my amendment to the amendment in nature of substitute?
Mr. Chair.
Ranking Member Bost.
Thank you, Mr. Chairman. I oppose the chairman's amendment, my amendment in the nature of a substitute. This amendment would open up eligibility for post 9/11 GI Bill to all veterans who have received a general discharge unless they were discharged for a serious crime. This is much broader expansion of benefits than my amendment. As a veteran who was subject to the UCMJ, and understand that, the veterans understand this, I know that there are many reasons that why a commander or a court-martial may decide to give a service member a general discharge. For us to insert our judgment like this is simply unprecedented. I believe it starts us down a slippery slope that can negatively impact good order and discipline in our military. I don't disagree that our committee and the Committee of Armed Services should take a broader look at why general discharges are given and the impact those have on veterans' benefits. However, we need to put in the work and have the discussion in the right venue where we can learn the views of the stakeholders on this significant change to current law. That is the right and thoughtful way to do this, not this political stunt that is being forced upon members at the 11th hour. I would also note that we understand that this amendment has a rough estimate cost of $11 billion over 10 years in mandatory cost. There is no offset in the amendment to the account of these costs. This means that this bill cannot go to the floor if the amendment is adopted. This further illustrates my point that the chairman is not being serious with offering the amendment, and it is meant to be a poison pill. I do not know about everyone else, but I'm sick of these type of partisan games in this committee. Last night, I filed my own substitute to the amendment, which was expanded and very successful VECTEC program. However, I decided not to offer the amendment at this time because I think it's time to stop playing these games and get back to the serious work of this committee. In that spirit, I would ask the chairman to withdraw his amendment and agree to work out this issue with us.
Ranking Member, I'm not going to withdraw my amendment. Are you finished with your?
Yeah, that response then is unfortunate, but not surprising. I urge all members to oppose the chairman's amendment and support the underlying amendment in the nature of a substitute, and I yield back.
Thank you, Ranking Member Bost. Mr. Lamb, you wish to be recognized?
Thank you, Mr. Chairman. I just wanted to make the point, I guess, that, you know, for people on active duty, they are required to take many vaccines, not just the COVID-19 vaccine, all designed for the purpose of keeping their fellow service members safe and themselves in the fight. So I guess the concern about Mr. Bost's amendment from the perspective of a recent service member is why COVID-19 is singled out for exception. You can easily imagine a scenario after this where younger service members in particular will begin objecting to all sorts of vaccines that they would otherwise be required to take, with the knowledge that nothing was waiting for them on the other end of it worse than a general discharge under honorable conditions with all the benefits that they might want. So when it comes to the ranking member's point about substituting our judgment for commanders, I would just say that it would create a pretty difficult command climate for the commanders that right now want to keep their troops safe and healthy and in the fight if their troops believe that they can basically decide which vaccines that they want to receive and which ones they don't, and that the penalties for that decision are minimal. So, you know, I take his point about the cost and about the broader political implications of this, but I would yield my time to the ranking member, I suppose, if he could answer why it is that the COVID-19 vaccine, which is relevant to a more virulent disease that threatens the lives of a larger number of service members right now than many of the other vaccines we're required to take, should be singled out for exception when, you know, all of the many vaccines that he and I both took while we were on active duty would not have the same treatment. I would yield to the ranking member.
Thank you. I thank the gentleman for yielding. Let me explain that this is a new vaccine. we don't know what the long-term effects are. There's also questions of how the vaccine is made that would affect people's religious beliefs, where that is not the case with many other vaccines that we were required. Now, what we're talking about here is the fact that you have 60,000 reservists that have all of a sudden decided they're not, this isn't a small item, this is a very large item, and it's reducing the amount of readiness that we have based on questioning the science. Also, the thing is like I said, the concern that they might have a religious way in which it was originally put together. And we've moved this through at a very quick pace, and now we've made a decision to do this to long-term military personnel who have had a very, very excellent record, except for we come up to this. And this is the only thing. Now, when we talk about the other amendment, you've got to realize that in that case, we don't know what the rest of their records are. And if a person is discharged or given a less than honorable discharge based on anything other than the vaccine, then that would be have to be analyzed from that standpoint. But right now, we're seeing a lot of people that are going to lose their benefits based on their religious belief and or decisions for their health. And so, I mean, it is different.
Again, I see how that's different from the other conditions contemplated in the chairman's amendment, but not from that really of other vaccines. I mean, the military couldn't mandate this vaccine until the EUA was ended. It was the product of a very extensive process of science that has played out all over the entire world. And I'll just as a personal anecdote, when I reported to Quantico in October of 2009, we were in the midst of a swine flu epidemic at the time. And we were all given experimental vaccines. Not a single person objected or raised any issue to it. And the only difference between now and then was that the COVID-19 vaccine has been politicized. And I don't think
Will
it's
the gentleman
right.
yield again?
I don't think it's right to yield to that politicization in a way that'll create an unstable climate for these commanders and most importantly, threaten the lives of our troops. And I have about a minute left on the clock. I'll yield the balance to the ranking.
Thank you very much. The only thing I would add to that is the fact that this vaccine came in after the fact. These men and women who joined the military, there were vaccines that you knew when you were coming in that you could take. And some of those you can deny to take. There are certain ones. Matter of fact, I think there's a couple of them that you've had certain childhood diseases, you are automatically given the opportunity to deny it. So that's not new. What is new is the fact that this came in after the fact, and we're changing these people's careers based on the fact of a creation of a new vaccine. That is quite a bit different. But thank you. I appreciate the gentleman yielding.
Does any other member wish to be recognized? Ranking Member Rosendale.
Thank you, Mr. Chair. I'm fed up with the antics surrounding COVID-19 measures against our service members. Allow me to summarize the current state of play. The DoD has mandated COVID-19 vaccines in order to maintain the health and readiness of the force. But this vaccine cannot prevent infection anymore because it was created for a COVID variant that has been extinct for over a year and has the highest risk of heart inflammation for fighting-age males. What sense did it make forcibly separating or barring from service tens of thousands of men and women because they refused to take a nearly useless vaccine that risks harm to their heart? The Guard and the Reserve are barring tens of thousands of men and women from service. That is a core-sized element in the name of readiness. Oh my God. That's frightening. How is that supporting readiness? Okay, fine. We've destroyed their trust, destroyed their military careers, and destroyed an unquantifiable amount of institutional knowledge. At least they can take their earned benefits and retire peacefully, right? Of course not. This bill was intended to protect the benefits of those who chose to separate from the service rather than violate their conscience. But this amendment does not allow them to leave in peace. No, on their backs, this amendment would open up the GI Bill to nearly everyone who separates from the military, regardless of the character of service, and turns these benefits into a treat for everyone. At the same time, this amendment essentially equates those who refuse vaccines as a matter of their conscience with deserters, mutineers, spies, rapists, murderers, arsons, burglars, and kidnappers. If you agree with this bill, you wouldn't be offering this amendment. That dramatically alters it. This is not a good faith amendment, and it's obvious to everyone that you think that no one should be free to refuse the vaccine. Is this what it's come to? Is this what you all think? I'm disgusted with this amendment. This is nothing more than a malign attempt to turn the screws on service members who have different thoughts on vaccines. I'm disgusted with this amendment, and unfortunately, I will be forced to oppose this legislation if, in fact, this amendment does pass. Thank you, Mr. Chair, and I yield back.
Well, thank you, Ranking Member Rosendale. Does any other member wish to be recognized
Mr. Chairman?
Mr. Roy, I
Mr.
do
Chairman.
see you. I just want to make sure there's no other majority member. Ranking Member Representative Roy, you're recognized for 5 minutes.
Okay, thank you, Mr. Chairman. Yeah, I didn't want to try to get in front of someone on your side. I didn't see, but thanks for recognizing me for a moment on this legislation and the amendments. Let me first say and take them in a couple different categories. First is the underlying merits of the bill, Mr. Fitzgerald's bill. I support that bill, and I support the ranking member's amendment to pay for the bill. Although I would note that we're paying for something that that we should have already been providing those benefits in the first place, in my view. But look, this is something that has been politicized. Okay, that's the reality. I mean, to Mr. Lamb's point, I understand that question. I would argue that this this vaccine in particular, has been politicized in a way that others haven't. Nobody on this side of the aisle or your side, the Dem side of the aisle, wants to interfere with a ability of a commander, for example, in a submarine to be able to say he wants to make sure his submarine is safe for military readiness. My dad's a survivor of polio. We're all grateful for the polio vaccine existing. The issue here is there is very, very serious questions, or are very serious questions about the benefit to this vaccine with respect to transmission. Even CDC Director Walensky has raised serious questions herself about the benefit of the vaccine with respect to halting transmission. If you look at the viral loads, if you look at the actual reports that the CDC put out, that's a real issue. So then if it isn't beneficial for transmission, which I think is a very legitimate question, and when you're talking about a vaccine, a shot that is mRNA-based, which is not something that we've got a great deal of experience with over decades, over a century, versus traditional vaccines, or for example, with respect to the flu shot or dealing with the swine flu that was raised earlier, those are in the more traditional sense, ones that have more data on, more experience with. Now we've got this. We go out with an emergency use authorization. We then go straight to the military and we say, you guys, you're going to have to take this vaccine. And then as data starts unfolding and we start looking at it and we start having questions being raised about the pros and cons for an otherwise healthy young American serving in the military, and those individuals choose not to avail themselves of that. And then you have, as I did, a 19-year service member in my office breaking down emotionally because he's getting ready to be generally discharged. Now let's come back to the point of the bill. You're generally discharged because you believe it is against your health or your religious views to take this vaccine, and it has been politicized, and there is no discernible benefit with respect to transmission, that Congress ought to step in here and ensure that we're not losing these valuable service members. Sure, if there's some basis to say, fine, on a submarine or in close quarters or certain areas of the military where it's appropriate, then fine, but not be discharged. It moved to a different place or some other place, especially when we're at 40% recruiting levels for the United States Army. We're at a massive bleed right now in terms of our ability to make sure our armed forces have the personnel necessary. I would suggest this amendment is not, the underlying bill is not only necessary, but it is a good response to ensure that those GI Bill benefits are available and we can continue to recruit. I respectfully disagree with the chairman's amendment. You want to have a debate about other general discharges? Let's bring them up topic by topic. But we shouldn't insert ourselves into the decision of how people have performed, performance of duty, crimes they may have committed, whatever the bases are for having been generally discharged versus honorably discharged should be left to the armed forces. The reason we're having oversight on this is because the politicized nature of this particular vaccine, an experimental use authorization with respect to response to COVID, and then now very legitimate questions brought about by even our public health officials like Director Walensky about whether or not there's any benefit at all from a transmission standpoint, as opposed to making the benefit for your own health consideration, weighing clots, weighing all of the issues that have been raised for our younger personnel that and heart conditions and other things that are very legitimate inquiries. The data are raising serious inquiries. We ought to be having hearings about that rather than getting in the way of a bill designed to ensure that our service members are able to access their GI benefits. I fully support the underlying bill. I oppose the chairman's amendment, and I yield back.
Thank you, Mr. Roy. Well, Mr. Roy, I just want to remind you that the vaccine mandate for our military could not have occurred under an EUA, under a emergency use authority, during which the FDA was still reaching final conclusions about the vaccine safety. And so once that EUA ended and we were able to move toward a mandate because the FDA approved the vaccine, that is the time at which employers outside of the military could actually issue mandates within their workplaces because of an employee context. So in terms of the line of argument about it being experimental, that's simply not true. Also, I do want to address the issue about transmissibility. That wasn't the only claim or even the most senior claim about the effectiveness of the vaccine. The vaccine inhibits and prevents serious illness or death. And we know that from later variants of the COVID virus, the COVID-19 virus, that we've gotten variants that are far more transmissible, more easily transmissible because of the later variants. But I don't think you can deny, or anyone on this committee can deny, that nearly a million or a million plus Americans have died of COVID or COVID-related complications, and undeniably, those who have the great majority of those who have died, or the great preponderance of those who have suffered serious illness or death, are often those who have not been vaccinated. So the utility of the vaccine is not only in terms of preventing transmission, which it's the transmissibility of the current variants is currently very clear. Regarding the arguments about criminality, this is not, my amendment has nothing to do with criminals or service members who are criminals. My amendment specifically prohibits anyone from accessing these benefits if their discharge is at all related to a serious crime. So anything related to a serious crime, if their discharge is related to that, and we're talking about general discharges that occur under honorable circumstances. So we're not talking about just any discharge or a general discharge. We're talking about general discharges that are predicated upon honorable circumstances. My amendment only seeks fairness. If the ranking member and the sponsor view it fair to give one group of veterans benefits, other veterans in that same classification should have the same benefits. And look, related to cost, not all the veterans that we're talking about in the class proposed by the ranking member, nor the classes, the similar and related and equivalent classes that I am seeking to include, are going to mean that everybody is going to get the GI Bill. It pertains to those veterans, those service members who've earned the benefit. You have to serve a full 5 years to earn the full 5-year GI Bill benefit. If you are discharged within a year or 6 months, it's not going to apply to you. The Congressional Budget Office estimates that 10% of all honorable conditions, all honorable condition discharges are given this separate but equal designation. This means that in addition to the 2,000 to 3,000 service members covered by the base text of this legislation, my amendment would include an additional 60,000 annually of service members who were given access to the benefit they've earned. Now, regarding the seriousness of this proposal, I admit there is a real cost to expanding these GI Bill benefits. That is true, and I plan to continue to work with the CBO to identify the exact costs. But just as we put our duties first by passing the Honor Merit Pact Act, we should do the same by finally bringing upstanding veterans fully back into VA. Now, look, I'm not denying that the class of veterans you seek to connect to GI Bill benefits is worthy, but I think that those veterans that were discharged because of Don't Ask, Don't Tell, which has nothing to do with crimes they've committed, but simply being who they are, that these veterans have waited an awful long time to get remedied. And I'm deadly serious. I'm dead serious about making sure that justice is done by these veterans. And so not only will I not withdraw my amendment, I stand by it 100%. I now, Dr. Ruiz, you wish to be recognized. Dr. Ruiz, go ahead.
Yes, thank you. I wish to correct some of the disinformation that has been stated just recently by a couple of our colleagues. And I say intentionally because it is purposeful. It is not misinformation, it is disinformation. So first, there was exemptions for people who refuse the vaccines for health reasons and religious reasons. They are still able to get their benefits, so this doesn't apply to them. Second, the vaccine works. It absolutely works. In fact, the CDC still claims that it is the best source of protection, the best source of protection of decreasing hospitalizations and death from COVID-19. In fact, what we have heard is nothing but extreme anti-vaccination political partisan views that these vaccines do not work or that they harm people, or the same disinformation that's being spread in order to decrease the use of this vaccination. Recent studies show that by far,
One, two, three. Love technology.
does provide protection. The vaccine works. I need to clarify the record, dispel this disinformation, because there are veterans listening to this who are still trying to decide whether they want to get their booster. And by saying otherwise and that it doesn't work and discouraging veterans from getting their vaccination, you are putting the veterans' lives at higher risk of getting hospitalized or dying from COVID-19 if they are unvaccinated or do not keep up with the boosters. And the CDC and Dr. Walensky will state the exact same thing, that the vaccines work. Their recommendation is to get the vaccines and to get all the updated boosters in order to prevent hospitalizations, in order to prevent death, to minimize your risk of hospitalizations and death. And with that, I yield back my time.
Thank you, Dr. Ruiz. Are there any members who wish to speak to my amendment to the amendment in nature for a substitute? If not, we will, the question is now.
Excuse me, Chair Takano.
Representative Miller-Meeks.
Thank you very much. And I'm just going to address Representative Lamb's comment that he didn't know why anybody would refuse. So as a 24-year military veteran, married to a veteran, a family of 6 of my members, 6 of my siblings served in the military. My father was in the military. I have tremendous respect for the chain of command and for following orders. However, I can certainly see as a physician and a nurse, married to a nurse, why a young soldier would want to decline a vaccine that was experimental, was rapidly produced, and that is because of health risks, regardless of anybody's religious viewpoint. And these health risks have been, in my opinion, and in the opinion of other physicians and other public health workers, not addressed. Those issues are myocarditis and pericarditis, diseases which in young men are very prevalent. Even the CDC has tried to minimize that information, but it continues to come out in journals from across the world, and also menstrual irregularities, which people in the medical profession were denying that there were menstrual issues in young women who were vaccinated. And I'm vaccinated and I gave vaccines. So let me just clarify that. And those menstrual irregularities were brought forth again by the British Medical Journal. And finally, we are acknowledging them in the United States, both through CDC, but other medical journals. So you have clotting issues, you have cardiac issues in young males, far in excess to other types of vaccines. And you have menstrual irregularities, which young women then question whether or not they will have fertility issues later in life. So I think there are very serious issues for a vaccine that does prevent hospitalization, can prevent death, but the risk of hospitalization and death in a young person is infinitesimally low. So I can certainly see why individuals would want to question this. It's something that I think the military would be wise to reconsider its position. But I certainly understand why there would be serious concerns about this particular vaccine and not other vaccines that are required to get, and especially required to get if we're deployed. Thank you so much. Sorry, I yield back my time.
Thank you, Dr. Miller-Meeks. And the question now is on my amendment to the amendment in the nature for a substitute. There being no further discussion, so all those in favor of my amendment to the amendment in the nature for a substitute will say aye. Aye. All those opposed will say no.
No.
In the opinion of the chair, the ayes have it, and the Takano and amendment.
Chairman, I requested recorded vote.
A recorded vote has been requested. Is there a second? Second. There is a sufficient second. A recorded vote is ordered pursuant to Committee Rule 4. Further proceedings on the measure shall be postponed. So, members, we are going to start voting on the postponed votes. And so please get on your platform, because we cannot record your vote unless we can see you. Let's make sure that we're all ready to vote on the queue of recorded votes. In order, we will be considering H.R. 8215, H.R. 5776, H.R. 3693, H.R. 6671. So we'll take a bit of just a pause to make sure we can get everyone on the platform and prepared to vote. Look at Levin. Mr. Banks. Captor, Cormick. Okay, do I, is there a script? We will now move to the unfinished business of the recorded votes, which were postponed. Recorded votes were ordered on the following measures. So H.R. 8215. 15. The question now occurs on favorably reporting H.R. 8215 to the House. The clerk shall call the roll.
Ms. Brownlee?
Aye.
Mr. Lamb?
Aye.
Mr. Levin?
Aye.
Mr. Pappas?
Aye.
Ms. Luria? Ms. Luria? Mr. Mervan?
Aye.
Mr. Mervan? Mr. Mervan?
Aye.
Ms. Sheriff McCormick?
Aye.
Mr. Sablon?
Aye.
Ms. Underwood?
Aye.
Mr. Allred?
Aye.
Ms. Frankel?
Aye.
Ms. Slotkin?
Aye.
Mr. Trone? Mr. Trone? Ms. Capter? Ms. Capter? Dr. Ruiz?
Aye.
Mr. Gallego?
Aye.
Mr. Bost? No. Ms. Radewagen?
No.
General Bergman? No. Mr. Banks? Mr.
No.
Mr. Roy? Mr. Roy?
No.
Mr. Mann?
No.
Mr. Moore?
No.
Ms. Mace? No. Mr. Cawthorn? Mr. Cawthorn? Mr. Nels?
No.
Mr. Rosendale?
No.
Dr. Miller Meeks?
No.
Mr. Elzey?
Elzey, no.
Ms. Conway? Mr. Trone?
Yes, please.
Ms. Capter? Ms. Capter?
Yes, yes. Can you hear me?
Yes, ma'am, gotcha.
Ms. Capter, we need to have you on the, there, you opened up another one. Okay. Ms. Capter votes yes.
And Mr. Cawthorn? Mr. Cawthorn? And Mr. Chairman?
Mr. Chair, the chairman votes aye. Are there any members who wish to change their vote? The clerk shall report the vote.
Mr. Chairman, for this vote, there are 17 ayes and 13 noes.
The motion is agreed to, and the bill is reported ordered. Without objection, the motion to reconsider is laid on the table. Without objection, the staff is authorized to make necessary technical and conforming changes to the committee amendments.
Chairman.
Ranking Member Bost.
Mr. Chairman, pursuant to House Rule 11, Clause 2, I give notice of intent to file minority or supplemental, additional, and/or dissenting views on H.R. 8215, as amended.
Without objection, so ordered. We will now move to consider H.R. 5776. Recorded votes were ordered on the motion to favorably report H.R. 5776. The question now occurs on favorably reporting H.R. 5776 to the House. The clerk shall call the roll.
Ms. Brownlee?
Aye.
Mr. Lamb?
Aye.
Mr. Levin? Mr. Levin? Mr. Pappas?
Aye.
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 Mr. Pappas?
Aye.
Ms. Luria?
Aye.
Mr. Mervan?
Aye.
Ms. Sheriff McCormick? Ms. Sheriff McCormick?
Aye.
Mr. Sablon?
Yes.
Ms. Underwood?
Aye.
Mr. Allred?
Aye.
Ms. Frankel?
Aye.
Ms. Slotkin?
Aye.
Mr. Trone?
Trone's a yes.
Ms. Capter?
Aye.
Dr. Ruiz? Dr. Ruiz?
Aye.
Mr. Gallego?
Aye.
Aye.
Ranking Member Bost?
No.
Ms. Radewagen?
Aye.
General Bergman?
No.
Mr. Banks?
No.
Mr. Roy?
No.
Mr. Mann?
No.
Mr. Moore?
No.
Ms. Mace? Mr. Cawthorn? Mr. Cawthorn? Mr. Nels? Mr. Nels? Mr. Rosendale?
No.
Dr. Miller Meeks? Dr. Miller Meeks? Mr. Elzey?
Elzey, no.
Ms. Conway?
Are there any members who wish to change?
Still have to go through.
Oh, excuse me,
Right.
Chairman.
Mr. Levin? Mr. Levin?
This is Dr. Miller Meeks. How am I recorded?
Dr. Miller Meeks was not recorded.
Dr.
I'm a
Miller
no.
Meeks- Dr. Miller Meeks is a no.
They didn't get you.
Great to be part of such a
Mr.
good
Levin?
team. I want to thank
Yes, aye.
Mr. Levin for.
Mr. Levin votes
having-
aye.
Mr. Cawthorn? Mr. Cawthorn? And Mr. Chairman?
The chairman votes aye.
Can you confirm I'm recorded as an aye, please? Mrs. Levin?
Mr. Levin, you are confirmed as an aye.
Thank you.
Mr. Levin is recorded as aye. Are there any members who wish to change their vote? Again, any members who wish to change their vote? Clerk will report the vote.
Mr. Chairman, for this vote, there are 19 ayes and 11 noes.
The motion is agreed to, and the bill is ordered reported. Without objection, the motion to reconsider is laid on the table. Without objection, the staff is authorized to make necessary technical and conforming changes in committee amendments. Ranking Member Bost.
Mr. Chairman, pursuant to House Rule 11, Clause 2, I give notice of intent to file minority or supplemental addition or dissenting views on H.R. 5776.
Without objection, so ordered. We now, recorded votes were ordered on the Brownlee amendment in the nature of a substitute to H.R. 3693. The question now occurs on agreeing to the Brownlee amendment in the nature of a substitute to H.R. 3693, on which a recorded vote was ordered. The clerk shall call the roll.
Ms. Brownlee?
Aye.
Mr. Lamb?
Yes.
Mr. Levin? Mr. Levin?
Aye.
Mr.
Aye.
Mr. Pappas?
Aye.
Ms. Luria?
Aye.
Mr. Mervan?
Aye.
Ms. Sherfless McCormick? Ms. Sherfless McCormick?
Aye.
Mr. Sablon?
Aye.
Ms. Underwood? Ms. Underwood?
Aye. Aye.
Mr. Allred?
Aye.
Ms. Frankel?
Aye.
Ms. Slotkin?
Aye.
Mr. Trone?
Aye.
Ms. Capter? Ms. Capter? Dr. Ruiz?
Aye. How many times do I have to say it? Aye.
Dr. Ruiz?
Aye.
Mr. Gallego? Mr. Gallego?
Aye.
Ranking Member Bost?
No.
Ms. Radewagen?
No.
General Bergman? No. Mr. Banks?
No.
Mr. Roy?
No.
Mr. Mann?
No.
Mr. Moore?
No.
Ms. Mace? Mr. Cawthorn? Mr. Cawthorn? Mr. Nels?
No.
Mr. Rosendale?
No.
Dr. Miller Meeks?
No.
Mr. Elzey?
Elzey, no.
Ms. Conway? Mr. Cawthorn? Mr. Cawthorn? And Mr. Chairman?
Chairman votes aye. Are there any members who wish to change their vote? Again, are there any members who wish to change their votes? The clerk will report the vote.
Mr. Chairman, for this vote, there are 17 ayes and 13 noes.
The amendment is agreed to. Without objection, the motion to reconsider is laid on the table. I now recognize Vice Chairman Representative Brownlee for a motion.
Sorry, Mr. Chairman. Mr. Chairman, I move that HR 6671 be.
No.
No. Sorry.
3693.
Not in my script. Mr. Chairman, I move that HR 3693 as amended be reported favorably to the House.
All those in favor will say aye. Aye.
Aye.
Aye. All those opposed will say no. In the opinion of the chair, the ayes have it, and the motion is agreed.
Mr. Chairman, we do request a recorded vote on this.
A recorded vote has been requested. And the question now occurs on the motion to favorably report HR 3693 favorably as amended. So the question now occurs on the motion to favorably report HR 3693 as amended to the floor. The clerk shall call the roll.
Ms. Brownlee?
Aye.
Mr. Lamb?
Yes.
Mr. Levin?
Aye.
Mr. Pappas?
Aye.
Ms. Luria? Ms. Luria?
Aye.
Mr. Mervan?
Yes.
Ms. Sheriff-Lewis McCormick?
Aye.
Mr. Sablon?
Aye.
Ms. Underwood?
Aye.
Mr. Allred?
Aye.
Ms. Frankel?
Aye.
Ms. Slotkin?
Aye.
Mr. Trone?
Aye.
Ms. Capter?
Aye.
Dr. Ruiz?
Aye.
Mr. Gallego? Mr. Gallego?
Aye.
And Ranking Member Bost?
No.
Ms. Radewagen?
No.
General Bergman? No. Mr. Banks? Mr. Banks?
No.
Mr. Roy?
No.
Mr. Mann?
No.
Mr. Moore?
No.
Ms. Mace? Yes. Mr. Cawthorn? Mr. Cawthorn? Mr. Nels?
No.
Mr. Rosendale?
No.
Dr. Miller Meeks?
No.
Mr. Elzey?
Elzey, no.
And Ms. Conway? Mr. Cawthorn? Mr. Cawthorn? And Mr. Chairman?
Chairman votes aye. Does any member wish to change his or her vote? Again, does any member wish to change his or her vote? The clerk will report the vote.
Mr. Chairman, for this vote, there are 18 ayes and 12 noes.
The motion is therefore agreed to, and the bill as amended is ordered as reported. Without objection, the motion to reconsider is laid on the table. Without objection, the staff is authorized to make necessary technical and conforming changes in the committee amendments.
Mr. Chairman,
Ranking Member Bost.
pursuant to House Rule 11, Clause 2, I give notice of intent to file minority and supplemental addition or dissenting views on H.R. 3693 as amended.
Without objection, so ordered. Recorded votes were ordered on the Takano amendment to the Bost Amendment in the nature of a substitute to H.R. 6671. The question now occurs on agreeing to the Takano Amendment to the Bost Amendment in the nature of a substitute to H.R. 6671, on which a recorded vote was ordered. The clerk shall call the roll.
Ms. Brownlee?
Aye.
Mr. Lamb?
Yes.
Mr. Levin?
Aye.
Mr. Pappas?
Aye.
Ms. Luria?
Aye.
Mr. Mervan? Mr. Mervan?
Aye.
Ms. Sherflis McCormick? Ms. Sherflis McCormick?
Aye.
Mr. Sablon? Mr. Sablon?
Aye. Aye.
Ms. Underwood?
Aye.
Mr. Allred?
Aye.
Ms. Frankel?
Aye.
Ms. Sotkin? Ms. Sotkin? Mr. Trone? Mr. Trone? Ms. Capter?
Aye.
Dr. Ruiz?
Aye.
Mr. Gallego?
Aye.
Ranking Member Bost?
No.
Ms. Radewagen?
No.
General Bergman? No. Mr. Banks?
No.
Mr. Roy?
No.
Mr. Mann?
No.
Mr. Moore?
No.
Ms. Mace? Mr. Cawthorn? Mr. Cawthorn? Mr. Nels? Mr. Nels?
No.
Unmuted.
Mr. Rosendale?
No.
Dr. Miller Meeks? Dr. Miller Meeks? Mr. Elzey?
Elzey, no.
Ms. Conway? Ms. Sotkin?
No. Slotkin votes no.
Mr.
Oh, no?
Trone?
Yes, right? Trone votes yes.
Mr. Cawthorn? Mr. Cawthorn? Dr. Miller Meeks? Dr. Miller Meeks? And Mr. Chairman?
Chairman votes aye. Does any member wish to change his or her vote? Does any member wish to change his or her vote? The clerk will report the roll.
This is Dr. Miller Meeks. How have I voted?
How is Dr. Miller Meeks recorded?
Dr. Miller Meeks is not recorded.
Dr. Miller Meeks, how do you vote?
Would you please record me as a no?
Dr. Miller Meeks wishes to vote no. All right, the clerk will report the vote.
Mr. Chairman, for this vote, there are 17 ayes and 13 noes.
The amendment is therefore agreed to. Without objection, the motion to reconsider is laid on the table.
Mr. Chairman,
Ranking Member Bost.
go ahead and I need to speak before we start.
Yes, okay. All right. The question now occurs on agreeing to the Bost Amendment in the nature of a substitute as amended to H.R. 6671.
Mr. Chairman.
Ranking Member Bost.
You know, I'm disappointed that I feel like Congressman Fitzgerald's well-meaning bill has been hijacked by bad policy. For this reason, I will be opposing the bill as amended, and I cannot support the radical expansion of the benefits that are being proposed.
Ranking Member, thank you, Ranking Member Bost. All those in the question now is on the the question now occurs on agreeing to the Bost Amendment in the nature of a substitute as amended to H.R. 6671. All those in favor will say aye. Aye. All those opposed will say no.
No.
In the opinion of the chair, the ayes have it.
Mr. Chairman, I request a roll call.
A recorded vote is requested. Is there a sufficient second? There is. The question now occurs on agreeing to the Bost amendment in the nature of a substitute as amended to H.R. 6671. The clerk shall call the roll.
Ms. Brownlee?
Aye.
Mr. Lamb?
No.
Mr. Levin?
Aye.
Mr. Pappas?
Aye.
Ms. Luria?
Aye.
Mr. Mervan? Mr. Mervan?
Aye.
Ms. Sherfilis McCormick?
Aye.
Mr. Sablon?
Aye.
Ms. Underwood?
Aye.
Mr. Allred?
Aye.
Ms. Frankel?
Aye.
Ms. Slotkin? Ms. Slotkin?
Yes, they're still recommending.
Mr. Trone? Mr. Trone? Ms. Capter?
Aye.
Dr. Ruiz?
Aye.
Mr. Gallego? Mr. Gallego?
Aye.
Ranking Member Bost?
No.
Ms. Radewagen?
No.
General Bergman?
No.
Mr. Banks?
No.
Mr. Roy?
No.
Mr. Mann?
No.
Mr. Moore?
No.
Ms. Mace? Mr. Cawthorn? Mr. Cawthorn? Mr. Nels?
No.
Mr. Rosendale?
No.
Dr. Miller Meeks? Dr. Miller Meeks? Mr. Elzey?
Elzey, no.
Ms. Conway? Ms. Slotkin?
No.
Mr. Trone?
I'm a yes.
Mr. Cawthorn? Mr. Cawthorn? Dr. Miller Meeks? Dr. Miller Meeks? And Mr. Chairman?
Mr. Chairman, how am I recorded?
Is that Dr. Miller Meeks?
Mace.
Oh, how is Ms. Mace recorded?
Ms. Mace is recorded as a no.
Mr. Chairman, I'd like to change my vote to yes.
Ms. Mace votes yes.
Okay.
And Mr. Chairman?
Chairman votes aye.
She's a no vote.
I can't hear anything.
How is Dr. Miller Meeks recorded?
She is not recorded.
Dr. Miller Meeks, how do you vote? Dr. Miller Meeks, I cannot hear you.
This is Dr. Miller Meeks. How am I recorded?
Dr. Miller Meeks, how do you vote? You are not recorded.
I'm a no.
Dr. Miller Meeks wishes to be recorded as no. Does any member wish to change? Well, actually, the chairman, I voted right. Pardon me? Does any member wish to change his or her vote? The clerk will announce the vote.
Mr. Chairman, for this vote, there are 16 ayes and 14 noes.
Therefore, the Bost amendment in the nature of a substitute as amended is agreed to. Without objection, the motion to reconsider is laid at the table. I now recognize Chairwoman Brownlee for a motion.
Mr. Chairman, I move that H.R. 6671 as amended be reported favorably to the House.
Thank you, Chairwoman Brownlee. All those in favor will say aye. Aye. All those opposed will say no.
No.
No. In the opinion of the chair, the ayes have
Mr.
it.
Chairman, I do request a roll call.
A recorded vote is requested. The question now occurs on the motion to favorably report H.R. 6671 as amended to the floor. The clerk shall call the roll.
Ms. Brownlee?
Aye.
Mr. Lamb?
No.
Mr. Levin?
Aye.
And so.
Mr. Pappas?
Aye.
Ms. Luria?
Yes.
Ms. Luria? Mr. Mervan?
Aye.
Ms. Sheriff Lewis McCormick?
Aye.
Mr. Sablon?
Aye.
Ms. Underwood? Ms. Underwood? Mr. Allred?
Aye.
Ms. Frankel? Ms. Frankel?
Aye.
Ms. Slotkin?
Aye. I'm sorry, no. I'm sorry, no. Pardon.
Mr. Trone?
Trone's an aye.
Ms. Capter?
Aye.
Dr. Ruiz? Dr. Ruiz?
Aye.
Mr. Gallego? Mr. Gallego?
Aye.
Ranking Member Bost? No. Ms. Radewagen?
No.
General Bergman?
No.
Mr. Banks? Mr. Banks?
No?
Mr. Roy?
No.
Mr. Mann?
No.
Mr. Moore?
No.
Ms. Mace? Mr. Cawthorn? Mr. Cawthorn? Mr. Nels?
No.
Mr. Rosendale?
No.
Dr. Miller Meeks? Dr. Miller Meeks? Mr. Elzey?
Elsie, no.
Ms. Conway? Ms. Luria? Ms. Luria? Mr. Cawthorn? Mr. Cawthorn? Dr. Miller Meeks? Dr. Miller Meeks? Mr. Chairman?
Chairman votes aye. Does any member wish to change his or her vote? The clerk will report the vote.
Mr. Chairman, for this vote, there are 15 ayes and 13 noes.
Therefore, the motion is agreed to, and the bill as amended is ordered reported. Without objection, the motion to reconsider is laid on the table. Without objection, the staff is authorized to make necessary technical and conforming changes in the committee amendments.
Mr. Chairman, in pursuant to House Rule Clause 11, Clause 2, I give notice of intent to file a motion of or supplemental, additional, or dissenting views on H.R. 6671 as amended.
Thank you. Without objection, so ordered. This concludes the business of the markup. Does the ranking member or any member wish to be recognized before we adjourn?
Yes, Mr. Chairman, thank you. And I want to say I'm grateful for the efforts of the members here today and look forward to considering a majority of these bills on the House floor. And with that, I yield back.
The rising voice, the majority of these voices, like, okay, I get it. I'd like to see all the bills considered on the floor. I thank all members for their attendance. This meeting is now adjourned.
Thank you, Mark.
Thank you.
Justin Turo is going to walk over here. He has something to discuss.